I think we are done. A very good afternoon, ladies and gentlemen. And today we are going to start forensic medicine revision for the exam, which is going to happen just on coming Sunday. So, welcome everyone in this session. I hope I am audible and visible to medicine revision for the exam, which is going to happen just on coming Sunday. So, welcome everyone in this session. I hope I am audible and visible. Chalo ji. Let's start with the very first chapter of today's class. This is going to be approximately 3 hour class. Less than that only I'll to try to do it. So forensic medicine and science are going to give you approximately 10 marks, 10 plus marks only in the upcoming exam. So we are going to start with this. Now, first of all, I'll tell you about the recent updates which came in this. And that starts with your Indian legal system and the court procedures. All the important BNS which are there required for the exam. Wo I need to bro. So we are going to start with this. First of all, chapter number 1 is talking about the legal procedures. Now, earlier we have heard about the IPC. Now, the new name which you have to remember for the exam is BNS because we are expecting 1 marks from this chapter for sure. We are having approximately 10 chapters in this all PDF, 50 pages, and those are going to give you 10 marks in the exam, which will make a good impact in your exam, and you all are going to pass. That is my for sure prayer for all of you. From wherever you are watching this session, we all are praying that God is going to bless your hard work and you are going to get succeed very soon. And your parents are going to be very super proud of all of you, each one of you very soon. And there are responsibilities which you have to take very soon, my dear friends. Let us start with very first thing is IPC. The new name of IPC is now Bharatiya Nyaya Sanhita. And total of 358 sections we have in this. Second, the name replaced is CRPC and now it is BNSS. My dear friends, this BNSS stands for Bharatiya Nagarik Suraksha Sanhita. So first is IPC, which is now changed to BNS, which is Bharatiya Nyaya Sanhita, and now it is CRPC, which is now changed to BNSS, which is Bharatiya Nagarik Suraksha Sanhita. And in this we have total of 531 sections. The third thing which is came a recent change is Indian Evidence Act, which changed to BSA, which is Bharatiya Sakshya Act. Now we'll put some more light on this, and we'll start with the 24 to 24 VNS criminal responsibility. And this criminal responsibility, we are going to talk about the age, mental illness, and the intoxication, where the person is responsible and not responsible, how these laws are working against them. Now, first of all, 20 to 24, put in your brain that you are going to talk just about the 20 and 24. So, what 20 BNS saying, my dear friends? Child less than 7 years not responsible. If a child's age who has committed a crime and the age is less than 7 years, the person, male or female, then both are not responsible for this. The best example you can take, like by mistake, a fire has been set by a child less than 6 or 7 years. By mistake, someone has switched on electricity, because of that someone dies, or there is some kind of serious harm. In that scenario, yes, age is a savior, and less than 7 you are not responsible for any crime. Next thing I want to talk about is 21 BNSL. Similar to this, but this time the age category is slightly up, and that is between 7 to 12 years. Now, if the same child has committed a same crime, for example, the crime is setting a fire, and that is setting a fire. Now the age is between like 7 years, 10 years, or someone has steal the money. किसी ने चोरी कर ली है, एज 10 साल की है, 11 साल की है. Now, sir, the responsibility, the criminal responsibility, be specific, I'll tell you that criminal responsibility depends on the court's decision. Court will decide about how much mentally matured or how much aware that person was or that child was before committing the crime, and that is how the 21 BNS commits. So 20 is less than 7 years of child and 21 is 7 to 12 years, my dear friends. Now comes the most important previous time famous question asked multiple time, expecting this time also, and that is none other than your McNaughton's rules. Earlier it was covered in 84 IPC. Now in BNS newer sections, we are covering this under 22 BNS, criminal responsibility of a mentally ill. So mentally ill person is never responsible for any crime. And here there are two intervals. We call that lucid interval. Lucid interval is between sane and insane. The sane person is अगर कोई पागल है, for example, someone was mentally challenged, but for some time because of the treatment or something, he was or she was very much fine, and during that time the person is committing a crime. Yes, that person is responsible for the crime, but if the person is not mentally sound, do not are aware of what is going to happen in that scenario, yes, they are going to be responsible for the crime. This is what lucid interval is: sanity, insanity, and that is McNaughton's rule. So agar koi dimag se challenge hai, yes, he is not she is not responsible for the crimes, but if it is opposite, yes, he or she is responsible for the crime. Now coming to the next BNS, my dear friends, and that is none other than your 23 BNS. 23 BNS and 24 are very much similar. For example, a person who do not drinks, or someone who went to a party and having a soft drink, and some other notorious guy or a girl has added some poisonous toxic substance into that person's drink or food, and after drinking involuntary taking that substance inside, the person got intoxicated, and that intoxicated person committed a crime. He or she do not know willingly, they didn't took any of the substance, but someone notoriously did that. So in that scenario, if that person commits a crime, no, he or she is not responsible for crime. But if you are taking this thing voluntarily and you are committing the crime, yes, you are responsible for this. So we have yet now covered the 4 5 BNS new sections, a beautiful one. Less than 7, I'll ask some questions and you guys have to answer in the chat box. That is the least expectation a teacher can have from their students, my dear friends. The number one question is less than 7, responsible or not responsible? Your answer should be in the chat box. That will make me aware that my students are learning along with me, my dear friends. Very nice. The first answer is less than 7 years, responsible, not responsible. My dear friends, the simple answer is going to be they are not responsible for any kind of crime. Now, my dear friends, involuntary intoxication. Involuntary intoxication, if it will commit a crime, well, he or she is going to be responsible. Well, he or she is going to be responsible. My difference, again, your answer is going to be in the chat box. And yes, the answer is very much correct. No, the answer is no, my difference. So first section of BNS we have committed, we have completed, we have learned, and we are satisfied. Second, coming on to the consent part. What is this consent, sir? Consent is nothing but a voluntary permission by a competent person. Now, the word competent here is something of a significance, my dear friends. Competent. What is competency mind? Sir, competency brain is something who is eligible. And first thing need a competency is your brain should be sound. Your brain should be sound, and then only you are competent enough to give someone a consent. And consent is a voluntary permission, whether to perform any surgery, whether to investigate someone, those all things comes under consent only, my dear friends. So we are going to deal with different sections of the consent. First is 25 BNS, my dear friends. Act not intended or not knowingly to cause death or grievous hurt, and those were done by a consent. There was no intention of causing harm or a grievous harm to a person not known to likely cause death or grievous harm done by a consent. For example, simple suturing a doctor is doing, that will never lead to a death, but consent is mandatory before that. Or doing some kind of physical examination in your OPDs, yes, you need some time a consent. Before putting a Riles tube, you know Riles tube is not going to someone takes life, but yes, it is required. You will put it with the consent. So those are things. 26 is something at not intended to cause death done in good faith of a person by consent, and that is something you are going to relate with surgeon doing a risky. Being a doctor, you should know 26 BNS is savior for all of us. We have done something and we have took a consent. How we take a consent? We verbally tell them not just the benefits of the surgery but also the risk factors. If you will not explain them the risk factor in their own language, then and there you don't have mandation to speak the language you know. Try to have a translator. If the person is belonging to village, they don't understand English at all, be a good translator in Hindi or whatever language they understand. Explain them, take in written, not just benefits, also the risk factors. Those are, and other than benefits, I must say the risk factors are mandatory to explain to patient and their relatives. And always take the consent from blood relative. Never take consent from any of the non-blood relative. Those are the friends, etc. Legally, you will not find your case on your side after doing that blunder or a mistake, my dear friends. 27 BNS. Act in a good faith by a person less than 12 years of age or mentally ill by a consent of guardian. For example, a small baby came to an emergency with the complaint of colic pain, and that colic pain after diagnosis turned to be appendicitis. Appendicitis, my dear friends. In that, you can take a consent of a guardian and you can operate that patient. In that scenario, you do not need any consent from a patient itself. So, my dear friends, patient's consent is required when he or she is crossing the age of 18 years. Before that, you can say you can take a consent on their behalf. For the major surgeries, you can take a consent of their guardians, and guardians are blood relative only, my dear friends. Then coming to 28, consent under the fear misconception less than 12 years. Either the age was less or either there was a threat, or you can say the person was intoxicated or he was threatened badly, that he or she was under the fear, or the person was mentally unsound person. In all those scenarios, your consent becomes nullified, zero, negative, they become cancel, and this is covered under 28 BNS, my difference. 28 BNS, my difference. Then comes to 29 BNS. Consent for acts which are offense is not valid. For example, criminal abortion. You know the indications of abortions. We are going to talk in the coming chapters. No matter mother is giving consent, no matter the father is giving consent, but that consent for the criminal abortion is again not valid, or you can say it is again nullified, and that is covered under 29 BNS, my difference. Then coming 30, act done in good faith for a benefit of a person without consent in emergency. So, unconscious victim you found, and you know that surgery is the only way to save that patient's life. You cannot wait for the police to come, you cannot wait for the relatives to come and identify them, then give the consent. No, in that scenarios, you can take a call, you can do a surgery, and you are saved by a BNS called as 30 BNS, my dear friends. You are saved by BNS called as 30 BNS, my dear friends. So these are the different regarding to the consent, my dear friends. If you are a doctor, you perform a surgery for the patient's benefit, it is 26. If less than 12 years with the guardian's permission, 27. Misconception less than 12 years, mentally unsound, in all those scenarios, my dear friends, becomes under 27, 28. Then consent for acts which are not valid, for example, criminal abortion, 29, and emergency without consent, you are operating 30 BNS. These are some important BNS you have to remember for the exam, my dear friends. Now coming on to the next one. 63, 69, we talk about 79, sexual offenses. First of all, 63 is definition of rape. Minor girl with or without consent less than 18 years will be considered as rape. No matter he or she is your wife, he or she is your suppose, anything, no, it is less than 18, not it is your rape only. Then 64, punishment. of rape is going to be 10 years to the life imprisonment. 65, there are some certain cases. If the child age is less than 16 years and more than 12 years, the punishment is going to be slight higher. And my dear friends, that is going to be 20 years to life sentence. Yes, it is going to be 20 years to life sentence. And if less than 12 years of age is there, 20 years to death sentence. Otherwise, until. Thank you, Dr. Fazala Qureshi. Thank you so much. May God bless you. Keep growing in your life. Chaliye. So, 65 BNS punishment of rape in certain cases, less than 16, more than 12, it is going to be 20 years minimum to the life imprisonment. And if it is less than 12, my dear friends, remember it is going to be 20 years to the death, 20 years to the death sentence. 66, causing a harm during such forceful instance and the person goes into the vegetative state, that is person is on ventilated from prolonged state and not able to walk, not able to come out from coma, in such cases also the punishment is going to be from 20 years to the death. 20 years to the death, my dear friends. 20 years to the death. Coming on to the next, 67, if there is a separation in that scenario, you cannot have. If you have it, then it is also called as rape, coming to 2 to 7 years, my dear friends. By a authority person, if a person is in authority, police authority or some kind of government authority, there you are misusing your powers and you are doing such crime, then under 68 bns you are punished for 5 to 10 years. 69, using the false promises marriages. These days you will see such incidences most commonly, where the boy and a girl are in relationship and then later on the guy is accused that he made a promise of marriage, and on behalf of on the basis of that he made relations. So in that scenario, up to 10 years of imprisonment is there for the boys, and this is very hard for a guy to prove, so be aware about these things also, my dear friends. Then coming 70 bns. 70 bns, my dear friends. 70 bns is something which is talking about the gang rape. Here the age is more than 18 and less than 18 years. Sir, if the age is more than 18 years, again the 20 years minimum to the life sentence, my dear friends. Then less than 18 years, it is life imprisonment to the death sentence. लाइफ इम्प्रिजनमेंट टू द मिनिमम है कि आजीवन कारावास में रहना है, और मैक्सिमम है कि मार ही देंगे आपको, ठीक है. 71, रिपीटर ऑफेंडेड, देन अगेन life imprisonment to the death. 72, disclosure of identity up to 2 years, that can be by doctor, that can be by police person. Yes, that is punishable under 72. 73, publishing any matter related to the court proceeding, media person, etc. 73. Now, criminal force at least for the 15 years, at least for the 15 years, at least for the 15 years. Then coming 75, sexual harassment, physical contact, request for favors, showing the, and this is going to be up to 3 years. If you're passing any kind of sexual remarks, the punishment is going to be up to for 1 year. In this, I would love you to remember few things only. One is definition, one is normal punishment, and if the age is less than 16 or less than 12, then what is going to be the punishment? These are something, and also this gang. Whatever part I have highlighted, please remember this other than what I have taught you, my dear friends. Coming on to the next part, 76. Removal of clothes, 3 to 7. Voyeurism, to see someone. Private work, and that is male to female only. That is male to female only. While bathing, while changing their clothes, etc., doing their private activities. If you're watching them, this is called as voyeurism. The other name of voyeurism, can anyone guess in my chat box what is the other name of voyeurism? This has been asked in the exam multiple times previously also, my dear friends. Can you please guess? I think it will be fair enough for me to wait for you guys. Can anyone guess in the chat box? No one? Peeping Tom. Peeping Tom. Peeping Tom. Peeping Tom. Then coming first offender, 1 to 3 years. 1 to 3 years. Second time offender, 3 to 7 years. 3 to 7 years. Then coming to the 78, stalking. Not Nikita, no, not at all. I'll be telling you the meaning of fetish very soon. 78 BNS is stalking, and stalking is just not offline, you are following someone, it is online also. So, online, answer offline, both. Both it will be covered in this. Very good afternoon. Dr. Sunil from Agra has joined us. Very good, Nikita. It is Peeping Tom. First time 3 years, second offender 5 years is going to be the punishment. Again, I want to tell you 77 and 78. 77 is for voyeurism and 78 is for stalking. 78 is for stalking. 79, word, gesture, or act intended to insult the modacity of a woman. For example, you are remarking on her weight, face, hairs, height, etc. You are getting punished up to 3 years. So be aware before saying anything to a woman. If she complains to a police, definitely you are going to jail. For how long? That is again a question mark, my dear friends. Coming on to the next one. Offenses related to the marriage, and that too we are going to talk about the dowry. Sir, 80 and 85. The important ones too you have to remember. It is the death of woman within 7 years of marriage. Then the punishment to the husband and in-laws are going to be 7 years to the life imprisonment. Then 85 women suspected to cruelty by husband-in-law. They are beating her, making her forced to do household work, not treating her right, not giving adequate food, services, facility, freedom. In that scenario, my dear friends, 85 BNS you have to remember. अगर प्रताड़ना हो रही है, जबरदस्ती हो रही है 85, और अगर डेथ कर जाती है डाउरी दहेज के चक्करों में दोस्तों, so that's very poor and pathetic 80 BNS, and the punishment is minimum 7 years to the life imprisonment. In case of harassment, it is going to be up to 3 years, my dear friends. Important. Criminal abortion. Criminal abortion. Sir, number one, 88 BNS. Criminal abortion with mother's consent, without mother consent, and death of mother due to abortion. Three are very important. I must say, three are very important. With consent, without consent, mother dies. Again, repeat along with me. With consent, without consent, and the mother dies. So, three things you'll remember: 88, 89, and 90. With consent, without consent, and the mother dies. Three important things you'll remember in the exam. Next thing is about the 91 and 92. Such act done with the intent to prevent child born alive or cause to die after the birth. ऐसा एक्ट किया जाता है कि मरते ही बच्चा पैदा होते ही बच्चा मर जाए. 91. 92, causing death of a quick unborn child. एकदम से बच्चा पैदा हुआ, पेट पे लात मार दी, या बच्चे को नीचे गिरा दिया, या बच्चे का मुंह दबा दिया. Those all pathetic kind of activities coming under 92 BNS, my difference. Now, again, sir, if 93, less than 12 years abandoned by the parents, रेलवे स्टेशन पे छोड़ दिया, एयरपोर्ट पे छोड़ दिया, बस स्टॉप में बस में बिठा के छोड़ दिया, 12 साल से कम बच्चे को अगर छोड़ा जाएगा तो पेरेंट्स आर बुक्ड अंडर 93 BNS. ठीक है. 94, न्यूबॉर्न डेथ कंसीलमेंट. व्हाट इज दिस न्यूबॉर्न डेथ कंसीलमेंट? नया बच्चा पैदा हुआ, बच्चा पैदा होने का सबूत ही मिटा दिया सारा, पैदा होते ही उसको बरी कर दिया, कहीं पे बरी कर दिया, बर्न कर दिया, मतलब डेड बॉडी, मतलब उसकी बॉडी ही नहीं छोड़ी, कंसीलमेंट, छुपा ही दिया. बच्चा पैदा हुआ, उसको बिल्कुल कहीं पे रिकॉर्ड में ही नहीं आने दिया. सो दिस इज व्हाट कॉल्ड एज न्यू बॉर्न डेथ कंसीलमेंट, व्हिच इज कमिंग अंडर 94 BNS. 94 BNS. Next, coming under 100, culpable homicide. Sir, culpable homicide is something, the primary intention was not to kill someone, but yes, using some You can say some weapons which can cause death but intention was not there. This is something definition of culpable homicide. Best example I can take is person A hitting B. Person A is hitting B, and with the help of stick, with the help of stick, with the help of stick, with the help of stick. He knows it will cause hurt, but death was not primary objective. This is what called as, my dear friends, culpable homicide. Culpable homicide. Then come definition of murder. Murder is A. Yes. Yes. Definition is A should B. डंडे से मारा, मर सकता है पर मारना नहीं चाहता था, दैट इज कल्पेबल होमिसाइड. उठाया मार दिया, दैट इज डेफिनेशन ऑफ मर्डर. नाउ सर 103, 105 punishment of murder, punishment of culpable homicide not amounting to murder. मरा नहीं, बस बच गया, that is what. ठीक है, intention was not to kill but लड़ाई में heat up हो गया, मार दिया. सर 106 death due to negligence. नेग्लिजेंस दो तरीके की, मेडिकल एक, यू कैन सी जनरल पब्लिक नेग्लिजेंस. फॉर एग्जांपल एक गाड़ी लेके आ रहा था कोई, and the person who was driving the car has hit something, or someone who was walking into the pedestrian. He was pedestrian, or you can say the person was walking onto the path and someone hit him by mistake, and that is because of the negligence. Primary objective was not to hit, but because of something, he was busy on phone or something, the person hit it, and that will lead to a punishment of up to 5 years. But if medical negligence is there, a doctor who has left some kind of instrumentation etc inside the stomach, operation side, operative side, then this is going to be medical negligence, and punishment is going to be for 2 years only. Punishment is going to be for 2 years only, sir. Then coming 107 and 108, abatement of suicide. Sir, what is this abatement of suicide? Abatement of suicide is something you are provoking someone. अरे तू तो जिंदा रहने का हकदार ही नहीं, तू तो मर जा. अरे तू, तेरे से बेकार आदमी कोई नहीं, तू मर जा. अरे जी के क्या करेगा, मर जा. If you're continuously provoking someone to die, that is abatement of suicide. You will be booked under BNS 107, 108. 7, 8. आजा 7, तुझे लेके 8. ठीक. 109 attempt to murder. ठीक. And in this attempt to murder, in this the intention was to kill. Attempt was made to kill only. So this is attempt to murder 109. ठीक है. Attempt to culpable homicide. For example, A hitting the B and B survives the stick injury by A in a fight. B survive हो गया, ठीक है, डंडे की मार से, that is attempt to culpable homicide. या डंडा मारा बजा नहीं, that is attempt किया पर बजा नहीं, डंडे से मारा, यानी कि ग्रीवियस हर्ट नहीं. क्योंकि अगर वो तलवार से मारता तो डेफिनेटली किलिंग के लिए था, डंडे से मार रहा है हिटिंग के लिए था, किलिंग के लिए नहीं था, और उसमें भी वो बच जाता है तो वो अटेम्प्ट टू कल्पेबल होमिसाइड. सो डंडे से मारोगे अटेम्प्ट टू कल्पेबल, और अगर आपने किसी बंदूक से मारा है देन अटेम्प्ट टू मर्डर लग जाएगा, अटेम्प्ट टू मर्डर लग जाएगा. तो इसमें प्राइमरी इंटेंशन चेक करी जाती है, कैसी है, मारने की नीयत से करा था कि हार्म पहुंचाने की नीयत से करा था कि डराने की नीयत से करा था कि प्लान्ड था, तो उसी बेसिस पे आपकी पनिशमेंट बढ़ती कम होती है इसके अंदर सर. नाउ कमिंग ऑन टू द ग्रीवियस हर्ट. सो डेफिनेशन ऑफ हर्ट, किसी को नुकसान पहुंचाना. दिस कैन बी सिंपल बॉडी पेन ऑल्सो, बॉडी पेन ऑल्सो कवर्ड अंडर दिस. किसी शरीर को दर्द देना. वॉलेंटली कॉजिंग हर्ट, चांटा मारा, स्लैप, lead to pain, that is again coming under hurt. Definition of grievous hurt. Sir, definition of grievous hurt is, grievous hurt वो चीज है जिसके जैसे अंग, आपने किसी आंख को मुक्का मारा, आंख फट गई और आंख देखने काबिल नहीं, these are coming under grievous hurt. Grievous hurt by dangerous weapon. Earlier previous year question they were asking from this area sir. 118 dangerous weapon. ठीक है, 118 important. Then 124 is important, hurt by acid, throwing or administering etc. या तो पिलाया या तो फेंका. तो दो BNS यहाँ इंपॉर्टेंट है, एक बाय डेंजरस वेपन, ग्रीवियस हर्ट की बात हो रही है, देन अदर इज योर एसिड थ्रोइंग सर, अदर इज योर एसिड थ्रोइंग सर. Then coming on to the next page, false evidences. False evidences. Sir, 227, perjury definition, giving false evidence under oath. The person was under oath in the court of law, still he or she is giving the false evidence, comes under 227 BNS. Then coming 228 BNS, sir. Fabricating false, that means farzi, first copy. For example, farzi, first copy. फर्स्ट कॉपी, फर्जी फर्स्ट कॉपी, एडिटेड वन बोल दो, आपने फैब्रिकेट करा फॉल्स एविडेंस किसी के खिलाफ, देन इट इज 228 बीएनएस. सर, पनिशमेंट फॉर परजूरी फॉर गिविंग फॉल्स एविडेंस अंडर द ओथ इज अप टू 7 years. कोर्ट के अंदर हम बोलते हैं जो भी हम बोल रहे सच बोल रहे, सच के सिवा कुछ नहीं बोल रहे, हम शपथ खाते हैं. इफ पर्सन इज एथिस्ट, तो जरूरी नहीं है वो भगवान के नाम पे शपथ लेगा. द ही और शी कैन टेक अ नेम ऑफ एनीथिंग ही और शी इज कनेक्टेड टू और बिलीव इन. देन 224, इशूइंग फॉल्स सर्टिफिकेट. फॉर एग्जाम्पल सीएमओ, चीफ मेडिकल ऑफिसर या कैजुअलिटी मेडिकल ऑफिसर ने किसी को सर्टिफिकेट बना के दिया सर, और वो फर्जी सर्टिफिकेट था, देन ही और शी विल ऑल्सो बी पनिशेबल अंडर 234 बीएनएस. छुपा दिए, चुरा लिए. 228, डिसअपियरेंस ऑफ एविडेंस, डिसअपियरेंस ऑफ एविडेंस, ठीक है. एंड देन एग्जिबिशनिज्म, इफ यू आर शोइंग योर प्राइवेट पार्ट in public, then you are something doing illegal exhibitionism, and which is very very wrong, very very, no matter someone is enjoying or not, but if you are doing that kind of a crime, my dear friends, yes, you are punishable. Then sir, important BNSS, BNSS, sir, BNSS, नागरिक सुरक्षा संहिता की बात करेंगे. 2 BNSS, various definition including definition of various type of offense, bailable, cognizable, है ना, cognizable and non cognizable offense. एडमिट कार्ड आ गया है, कॉन्ग्रेचुलेशन टू एवरीवन. एडमिट कार्ड आने वालों को बहुत बहुत मुबारक हो, और जिनका नहीं आया है पट से एनबी को मेल डाला जाए, वापस से एग्जाम से पहले आ जाएगा, भरोसा रखिए. देयर आर सम डॉक्यूमेंट्स, देयर विल बी अ डेफिशिएंसी ऑफ सम डॉक्यूमेंट्स, दे विल डेफिनेटली गिव यू चांस टू फुलफिल इट. इफ यू आर एबल टू डू इट, वेल एंड गुड, यू गाइज आर गोइंग टू गेट दैट. चलो ठीक है. कॉग्नाइजेबल, नॉन कॉग्नाइजेबल इज अबाउट बेलेबल एंड नॉन बेलेबल, देन वारंट केस, समन केसेस, ठीक है. सो दोज ऑल थिंग्स वी विल बी कवरिंग अंडर 2 BNSS, ठीक है. 33 BNSS, क्राइम इन्फॉर्म टू पुलिस. सबसे पहले पुलिस को कहीं पे कोई वारदात हुई है, एक्सीडेंट हुआ, पुलिस को अंडर 33 BNSS. 51, मेडिकल एग्जामिनेशन ऑफ अरेस्टेड पर्सन फॉर एनी ऑफेंस, फोर्सफुल एग्जामिनेशन इज अलाउड. अब किसी की मेडिकल कराना आपको, लेट सपोज किसी ने शराब पी रखी है, एंड दैट ड्रंक पर्सन यू नीड टू गेट एग्जामिन्ड, उसमें उसकी परमिशन की जरूरत ही नहीं है, आप जोर जबरदस्ती करा के भी उसका एग्जामिनेशन करा सकते हैं. हु इज गिविंग यू परमिशन? 51, 51, ठीक है. देन 52, 52 सर, medical examination of arrest person accused of a rape, forceful, yes, it is allowed. For rape it is 52, for other it is 50, other forceful is 51, for rape it is 52. And 63 to 71 comes under summon. So my dear friends, few questions regarding the summon I am going to ask you, and you people will answer me. If a summon is coming from High Court or Supreme Court, sir, where you will go first? If a summon is coming from High Court, Supreme Court, where you will go first, sir, my dear friends? Tell me. Where you will go? You will go to Supreme Court. Meanwhile, you will inform to High Court कि मैं नहीं आ सकता या नहीं आ सकती, नहीं आ सकता या नहीं आ सकती, तो इन्फॉर्म, ठीक है. और अगर सर दोनों ही हाई कोर्ट हो, पहला वाला समन भी हाई कोर्ट से आया, दूसरा वाला समन भी हाई कोर्ट से आया। अब किसको पहले एड्रेस करोगे? कैन यू आंसर इन द चैट बॉक्स माय डियर फ्रेंड्स? नाउ टू whom you will address first if both the summons are from high court? My dear friends, now the mattering thing here, right, is timing. Timing. First one received will be addressed first. जिसका पहले आया उसको पहले entertain करिएगा सर. That's a basic fundamental rule of the summons you have to remember before going to the exam. My dear friends, next is 184 BNSS. Very good. Medical examination of a victim. That comes under 184, and if you have to talk the accused, then it is 52. So 52 and 184. Then, sir, police inquest and magistrate. I want to highlight with the yellow color because this is something which is important. Police inquest. What police inquest will cover? Panchnama. Panchnama is a primary report which is being prepared from the scene of crime. The minimum level of officer recruited here is a sub-inspector. Sub-inspector, sir. So Panchnama is covered by a police, then magistrate. Sir, any kind of mishappening done in police custody by police, or simply if I want to tell you by police. अगर पुलिस से कोई मिसहैपनिंग होती है, पुलिस फायरिंग में कोई मारा जाता है, कस्टडी में मारा जाता है, then those things are taken care by a magistrate. This is what called as magistrate inquest. Sir, other than that, all dowry cases will be taken care by magistrate inquest, sir. Not just this, one very famous term is their exhumation. What do you mean by term exhumation? Sir, digging of dead body. Digging of dead body is called as exhumation. It is done under the presence of magistrate. And my dear friends, this digging of dead body, yes, this digging of dead body is done in night time, at night time or daytime. So my different answer is bright daytime. Answer is bright daytime. Answer is bright daytime, sir. Bright daytime. So this beautiful chapter we have completed so far. This is going to give you 1 to 2 marks in the upcoming exam. Right from starting, I have told you the areas which I have marked with the yellow are the most important to know. Most important, these are the simplest one only. Okay. And regarding the consent also, these are important. So at least 12 to 14 are something you have to remember for your exam. This is a minimum expected from my side from you guys. Now we are going to cover the next chapter, and that is going to be traumatology. Traumatology, sir. Traumatology. So traumatology, the first thing we are going to talk about is force. Sir, force, if we talk about, sir, blunt force trauma. So what do you mean by blunt force and the sharp force? If a force is coming like this is something called as blunt force. If force is coming from this, hitting you, this is something called as blunt force. And first, the type of injuries which are produced by these blunt force, my difference number one is abrasion. Abrasion is something related to rugged. In Hindi we call this as ragad lag gaya. So ragad lag gaya, if you can see the image also, my dear friends, only which part is affected? Your epidermis is affected. Which part is affected? Your epidermis is affected. And after this ragad, if you have noticed, and the best example you can take, most common example, is a bicycle और रोड ट्रैफिक एक्सीडेंट के अगर छोटी सी बाइक से सीखते हुए भी गिर जाते हो, इन दैट टाइम ऊपर का एपिडर्मिस इज गॉन, थोड़े दिन में वहां पे काला काला हो जाता है, दैट इज स्कैफ फॉर्मेशन. ठीक है ना. टाइप ऑफ अबरेशन, स्क्रैच. मुंह पे किसी ने नाखून मार दिया, मियां बीवी की लड़ाई हो गई, नाखून मार दिया मुंह पे, दिस इज गोइंग टू बी स्क्रैच अब्रेजन. मुंह पे, पीठ पे, गले पे, कहीं पे भी हो सकती है स्क्रैच अब्रेजन. नाउ नेक्स्ट इज ग्रेज्ड अब्रेशन. Grazed abrasion, most commonly seen with the road traffic accident. Then, my dear friends, coming with the pressure abrasion. For example, bite mark, ligature mark, etc. Pressure से दिया हुआ bite mark. This is some love bite converted into dog bite, my dear friends. Pressure abrasion. Then pattern abrasion. अब जैसे रस्सी यूज करी तो उस प्रेशर की वजह से वहां पे पैटर्न आ गया. दिस इज कॉल्ड, ये टायर मार्क था, प्रेशर की वजह से पैटर्न आ गया. दिस इज कॉल्ड एज पैटर्न अब्रेजन. सो टोटल नंबर ऑफ अब्रेजन वी हैव लर्न सो फार आर 4 टाइप ऑफ अब्रेजन, माय डियर फ्रेंड. फर्स्ट इज स्क्रैच अब्रेजन, graze abrasion, sir, pressure abrasion, and the fourth one is going to be your pattern abrasion. Now I have talked about after abrasion, the healing process is a scab formation. So the color of scab is going to tell you how old the injury is, and that is a key point you have to remember for the exam. How it changes, the mnemonic is very simple to remember, and that is R R R B B B. R R R B B B. Sir, raw, reddish, reddish brown, brown and black. Very simple. Raw, reddish, reddish brown, brown black. Raw, reddish, reddish brown, brown and black. Less than 12, 12 to 24, 2 to 3, 3, 4, 2 to 3, 4 to 5, 6 to 7. 2 to 3, 4 to 5, 6 to 7. Less than 12, 12 to 24. This is how the pattern is moving forward. R, 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 B, B, B. R is raw, it is between less than 12. Then R reddish, 12 to 24 hours. Reddish brown, that is going to be, yes, 2 to 3 days. Then it's gonna be brown, that is between 4 to 5 days. Then it is going to be black, that is 6 to 7. Ultimately, the lower scale epidermis heals, the black one will go, new skin comes. For few days, it is more lighter of a color. Then again, after 2 to 3 months, you will see, again it will come back to the normal color of the adjacent skin. So this is what color of scab I was talking about, and how beautifully we have remembered just by remembering the abrasion. Abrasion is something related to epidermis is gone, scab formation, 4 types, scratch, graze, pressure, pattern, color of scab, RRRBBB, raw, reddish scab, reddish brown, brown. So these all are things which are important for the exam. Now contusion. Contusion is different from the abrasion. Sir, contusion is when epidermis is intact. You can very well see in this image also, sir. Your epidermis is intact. For example, our parents are hitting us with some stick. You know the skin is intact, but whole bruising is seen. That is extravasation of the blood is there. The whole blood is collected under the skin, and this is deoxygenated blood, which look more of a violet to the bluish color. More of violet to the bluish color. This is what called as contusion. And the margin you can appreciate right here. He is saying also it is a irregular margins. Here also you can see very well, this is your irregular margins. Swelling, yes, it is going to be there. Discoloration of skin, yes, that is going to be there. Collection of blood under the skin, yes, it is going to be there. Now the type of bruises we talk about is ectopic or migratory. चोट कहीं लगी, impact कहीं आया. So two things in this you have to remember. One is anterior cranial fossa fracture and middle cranial fossa fracture, my dear friends. Anterior cranial fossa fracture, you are going to identify with the help of raccoon eye or panda eye. Sir, multiple time repeated MCQ, not just in the FMG exam, also in the NEET PG exam. This has been asked multiple times. So anterior cranial fossa fracture will lead to a sign you can see clinically, and that is none other than your anterior cranial fossa, raccoon eye or panda eye. This is more of looking like a raccoon or panda. Then middle cranial fossa fracture. If your middle cranial fossa is gone, you are going to appreciate a better sign, that is bruising, ecchymosis behind the pin. Bruising, ecchymosis behind the pinna. This is middle cranial fossa and the anterior cranial fossa fracture we were talking about. Then fracture line, if we talk about, sir, fracture line. Sir, sutural or diastatic fracture. There are the suture lines, my dear friends. And if the line is running along the suture line, if the fracture line which is running along the suture line, and this is most commonly seen in the young adult, this is called a sutural diastatic. These are the sutural lines. This is a fracture line. This is a fracture line, my dear friends. Fracture line, my dear friends. This is called a sutural or diastatic fracture. Okay. If you are using a hammer हैमर से आपने किसी का माथा फोड़ दिया और यहाँ पे ऐसे डिप्रेशन पड़ गया, दिस इज कॉल्ड एज डिप्रेस्ड fracture. This is called as depressed fracture. Previous year question of the exam, depressed fracture. Now, next is an important previous year question, my dear friends. Ping pong fracture. Sir, ping pong fracture is happening in the newborn. How? Sir, the newborn which is getting delivered need a lot of forceps to get him out or her out. So in that scenario, the newborn skull is not that hard. So for that scene, you will see there's a dip on that, and that is more likely to be appreciating, or you can see synchronous to the ping pong. You compress it, it get compressed. After some time, it will come to the normal shape or a contour. This is what beauty of a ping pong fracture is. Or it, other words, we call this as Pons fracture also. Not just ping pong. The other words we call this as a Pons fracture also. Most common cause is going to be the forceps delivery, and this is most commonly seen in the infants. If you remember obs and gynecology, can you can you mention name of forceps which is used for the delivery, my dear friends? And the name is going to start from P, that is my initial letter only, and you are going to write in the chat box. You are going to write in the chat box also. Yes, P से start होता है, ठीक है, and आंसर देने वाले को मिलेगा 1 cup of coffee. Now, moving on to the next segment of forensic medicine, forensic ballistics. This is shotgun. The diameter, which opening we told that is called as bore. This is something barrel, breech, and stock. These are the parts of the shotgun. The inner diameter is called of a barrel is called as bore. Range, different ranges, my dear friends. Different range. Shotgun range is 50 to 60 yards. Important topic, my dear friends. Please keep your ear and brain open. Revolver, it is 200 yards, my dear friends. Pistol, 200. Revolver, 2. Pistol, 4. And the military rifle, which we have to talk about, is 2000 yards. 2000 yards. Shotgun, 50 to 60 yards. Revolver 200 yards, pistol 400, military rifle 2000 yards. Military rifle 2000 yards, my dear friends. Gunpowder. Some gunpowders they will produce the smoke, and some gunpowders they are smokeless. The gunpowders which are producing the smoke, my dear friends, those are black gunpowder, and what they have KCl. How I used to remember KCS. K for potassium nitrate, that is 75%, charcoal 15, and sulfur 10%. Potassium nitrate, charcoal, and sulfur. Again, along with me, potassium nitrate, charcoal, and sulfur 75, 15, 10, 100%. And this gunpowder, whenever you are firing some bullet from this made up of this gunpowder, my dear friends, this becomes easy to trace the path of a bullet. Always, because you'll be seeing a black line, or you can see the gunpowder being traced along the path from where, so you can go and check from where the shooting was done. Most of the time, not all the time, most of the time. So it is some kind of helpful in telling the crime. So in the advancement of this, we came up with the new solution, that is a smokeless gunpowder. Now, smokeless gunpowder, my dear friends, again coming into the three categories: single base, double base, and triple base. This smokeless gunpowder again came into the three subheadings. One is single, double, and the triple. The single base has a single thing called as nitrocellulose. Double thing has two things, that is cellulose and glycerine. Triple thing is having cellulose, glycerine, and guanidine. So one is cellulose in every one, then adding it to the glycerine, then adding it to the nitroguanidine. Nitroguanidine. So single base, double base, triple base, single cellulose, nitroglycerine, nitroguanidine. So those are the MCQs. If they are being asked in the exam, easy to do it, sir. Test, just the name of the test you have to remember. How they are performed, none of our business, my dear friends. Just remember some name of the test which are related to the gunpowder testing, and the mnemonic to remember this is hand. Heart. First is Harrison. A for atomic absorption spectroscopy. N stands for neutron activation analysis. D stands for dermal nitrate test or paraffin test, my dear friends. Again, I want to repeat for all of you. Please remember along with me. Hand is a mnemonic for the different tests we perform for the gunpowder. Gunpowder is of two types. One is smoke wala black जिसको बोला था KCS potassium nitrate, charcoal, sulfur. Then coming to the smokeless, single base, double base, triple base. Then coming to the test of these powders, and the mnemonic to remember this is hand. H stands for Harrison, A for atomic absorption spectroscopy, N stands for neutron activation analysis, D stands for dermal nitrate test, and another one is paraffin test, sir. Paraffin test, sir. Paraffin test. Now coming on to the gun shot by a shotgun. शॉट गन के द्वारा शॉट करी हुई गन का कैसा मार्क रहता है इन व्हाट क्वेश्चंस आर बीन आस्क्ड इन द एग्जाम द नंबर ऑफ फर्स्ट इंजरी इज कॉन्टैक्ट टाइटली ऑन टू द स्किन अब शॉट गन कहां थी माथे पे सटी हुई थी तब और वो सारी चीजें फाड़ देती है तो स्टिलेट वुड यू कैन सी द मार्जिन्स क्रूशिएट मार्जिन स्टार शेप wood star shape wood material star shape wood so this is taken from 0 meters this is taken from 0 meters then sir from 0 to 1 see whenever we are firing a bullet this for example this we are firing a bullet my dear friends on firing the bullet what will happen there is going to be fire what happening where is my fire okay here there is going to be fire so less than 1 meter shot which is also called as close shot there is going to be fire is going to burn after burn there's a blackening plus charcoal is going to get ingested inside there is going to be tattooing so burning blackening tattooing if it is observed the shot is close shot taken from less than 1 meters taken from less than 1 meters then sir coming to the near shot near shot is 1 to 2 meter now burning is not there tattooing can be there but you can see single hole with irregular margins much appreciated till now dispersion hasn't started yet dispersion is the pellets are getting dispersed like this this starts from 2 to 4 meters in the shot which is hit from 2 to 4 meters between 2 to 4 meters you can see single hole along with the single hole there are multiple rat holes that means dispersion has just started so if dispersion has just started that means there is going to be single rat holes surrounded by the pellet holes if it is more than 4 meters my dear friends if it is going to more than 4 meters complete dispersion is seen only the moles are seen no single hole only pellet holes are seen so different type of gunshots we have summarized beautifully in a single page my dear friends 0 meters 0 to 1 meters 1 to 2 meters 2 to 4 meters more than 4 meters now all of the names you have to tell me in the chat box 0 meter shot is called as my first question to all my dear friends who are watching me live right now sir yes 0 meters my dear friends I'm expecting answer from all of you 0 meter is called as contact shot close shot near shot intermediate shot and distant shot dispersion start from 2 complete dispersion 4 before that there is a no dispersion so this question if it will come in the exam I can trust on you guys beautifully you are going to mark answer as correct answer my dear friends coming on to the next part entry and exit wound friends entry wounds are small and exit wounds are large with the inverted margins, and exit wounds are having everted margins like this. जहां से घुस रहा है बुलेट वहां इन्वर्टेड, जहां से बाहर आ रहा है वहां पे इवर्टेड. दिस इज फॉर द गन शॉट माय डियर फ्रेंड्स. What about the knife injury, or you can say penetrating injury? Penetrating injury. What will happen in the penetrating injury? The entry wound is going to be large and exit wound is going to be small. Entry is and exit is small. उल्टा होता है. गन शॉट में जहां से घुसेगा वो छोटा है, निकलने वाला बड़ा. Penetrating में it is opposite. Entry wala large and exit wala is going to be small, my dear friends. Now coming to the next topic called as type of bullets. The different type of bullets we are going to learn under this heading in the next 2 minutes. Type of bullet. Number one type of bullet, tandem bullet or piggy bank bullet. One bullet follows the another bullet. One follows the another. One follows the another. This is called as tandem bullet or piggy bank. One follows another. One follows another. Tracer bullet, like black gunpowder we were talking about, KCS, potassium nitrate, charcoal, sulfur. So KCS अगर पड़ा होगा, black gunpowder, smoke produce करता है. Tracing the path of bullet is possible. That is tracer's bullet, sir. Tracer's bullet. Dum bullet, sir. You can very well see the shape of the bullet. The shape of bullet itself is telling that ये क्या करता है, अंदर जाके खुल जाता है दोस्तों. So this is going to be causing the maximum damage. This is going to be cause the maximum damage, sir. Then coming frangible. Frangible में how you will remember fragments. और in Hindi you can talk टुकड़े. जैसे ही bullet is going to hit the target, the bullet is going to get divided into small fragment, or in the other word you can say चूरा हो जाता है. चूरा हो जाता है bullet का. Bullet का चूरा. Bullet broke into fragments once it hits the target. Once it hit the target. Sir, next is ricochet or deflected bullet, sir. The bullet get deflected from the intermediate path. एयर हो सकता है, किसी सब्जेक्ट ऑब्जेक्ट से छू के हो सकता है, शूट करा सीधा चला गया यहाँ, शूट करा सीधा चला गया यहाँ. तो दिस इज गोइंग टू बी रिकोशेट और डिफ्लेक्टेड बुलेट्स. Incendiary is sounding something like an incident. Incident matlab blast. So this bullet explodes once it hit the target. This bullet explodes. फट जाता है बम की तरह, इसीलिए बम फटना is an incident. Incident is sounding like a bullet's name only. That is going to be incendiary bullet. This is how I will remember. Tumbling and yawning. Somewhere they are similar. Tumbling is something, tumbling motility we have seen in the microbiology also. Tumbling bullet is bullet which is rotating and then hitting the target. Bullet rotate and then hit the target is tumbling bullet. Yawning is something the bullet is moving on to this fashion. So I'll draw it for all of you to better understand. Tumbling is something which is bullet is going this fashion, this fashion, this fashion, then this fashion, this and this. So ऐसे गोल गोल घूम के जा रहा है और फिर बज रहा है. Yawning is something this patterns. Yawn करता हुआ ऐसे, then hitting the target. Express bullet. Now there is a hole in the base. Hole in the base is making bullet lightweight. और चीजें जो दोस्तों लाइट वेट होती है बहुत स्पीड में भागती है. स्पीड इंक्रीजेस, दैट इज वेलोसिटी विच इज गेटिंग इंक्रीज, इज कॉल्ड एज एक्सप्रेस बुलेट, सर. कॉल्ड एज एक्सप्रेस बुलेट, सर. सोविनियर, सो जाता है. द बुलेट, द पैलेट गोज इनसाइड द बॉडी, रिटेन्स इन द बॉडी. you'll not notice, you'll not see है कि नहीं अंदर, छोटा सा होता है. Then you will notice some fibrosis around the bullet which will tell you that there is a bullet. So these are the different type of bullets we have studied, my dear friends. I'll ask some questions and you will answer me in the chat box. Sir, one after another. If one after another bullet is coming, what is that called as? First answer from all of you. If one after another the bullet is coming, if one after another the bullet is coming, this is called as, please answer in the chat box. In if one after another the bullet is coming, this is called as, one after another is called as piggy bar or tandem bullet. Very good. Very good. Sadia Malik, very nice. If a bullet is moving into this fashion, then hitting the target, this is called as. If bullet is moving into this fashion and then hitting the target, this is called as. Moving in this fashion and then hitting the target, then this is called as. This is called as. Can anyone answer in the chat box? This is called as yawning bullet. Sir, if there is a hole in the base of the bullet and velocity is high, this is called as. If there is a hole in the base of the bullet and velocity is high, this is called as velocity high, hole in the base, this is called as. This is called as express bullets, sir. Express bullets. This is called as express bullets, sir. Sir, Kennedy phenomena. To study the entry and the exit wound is called as Kennedy's phenomenon. Kennedy's phenomena. Entry wound, inverted margin. Sir, exit wound, everted margin. Inverted margin and everted margin. Puppy's rule. Sir, fracture line will touch each other and tell the sequence of the bullet. एक fracture line, दो fracture line, they will touch each other, they will tell the sequence, पहले कौन सा आया, बाद में कौन सा आया. This is called as Puppy's rule, sir. This is called as Puppy's rule, sir. Then coming to the car injury. अब गाड़ी में गाड़ी ठुकी, माथा पाथा फट गया, इसके अलावा भी चीजें होती हैं. So car injury in brief, I'm going to tell you, sir. So first of all, if a car suddenly stops and your head is going to go like this, hyperextension, and this hyperextension of the neck is going to get an injury called as whiplash injury. This hyperextension of a neck is going to get you an injury called as whiplash injury. Then, sir, the glass is going to get broke, and that broken glass is going to hit your face. This is called a sparrow feet mark. The steering is going to touch your mediastinum part or your rib cage. Here you are going to get the aortic tear. The seat belt which you are wearing, it will lead to injury of your mesentery, my dear friends. So these are the four important type of injuries we are going to get in case you are in a car. You are in a car and a car getting injured. So because of hyperextension of the neck, you are going to get whiplash injury. For the glasses hitting onto the face, you are getting a sparrow feet mark. Steering touching will get you aorta. From the seat belt, you are going to get the mesentery. You are going to get the mesentery injury, my dear friends. Then blast injury, sir. Primary, secondary, and third degree and fourth degree injury. Yes, doctor, it is for NEET PG also. Primary blast injury. So basically, after blast, what is happening? Lot of air is coming. Lot of air is coming, and it will lead to damage of the cavity wala part. And first of all, the damaging is going to happen in the tympanic membranes, then the lungs. If you are underwater and their blast happens, then lungs are going to get damaged. Even intestine are going to get damaged, sir. This is primary. Then along with that air compression, there are going to be the objects which are coming and hitting onto your body. And those coming objects which are hitting your body will lead to pattern abrasion, contusion, laceration. Pattern abrasion, pattern contusion, pattern laceration. So these are the three pattern you will observe onto the person's body. So this is something called as Marshall's triad. Marshall's triad. So my question is, Marshall's triad you will see in which degree blast injury? So my dear friends, your simplest answer is going to be the secondary blast injury. Secondary blast injury. Then tertiary blast injury. You are thrown away onto the ground or wall. पहले तो कंप्रेशन आया, कंप्रेशन की वजह से कान का पर्दा फटा, ऑब्जेक्ट आए, बॉडी को टच करे, आपको नीचे गिराया. Then is fourth degree. The whole building or a structure collapsed onto you. The whole building or the structure it collapsed onto you is called as fourth degree, or you can say tertiary blast injury. Is called as tertiary blast injury. And underwater, if you have to choose between lungs and intestine and tympanic membrane, the answer supremacy is going to be with the intestine, my dear friends. The answer supremacy is going to be with the intestine, my dear friends. Intestine, my dear friends. Now coming on to the electrical injuries, my friends. Electrical injuries. Who is more dangerous? Two type of current we have, AC and DC. Who is more dangerous? Sir, AC is more dangerous than the DC. And cause of death in the electrical injury, most commonly it is due to the cardiac arrhythmias, respiratory failure. Most resistant organ to the electrical injury, yes, bone is going to be better answer than the skin, sir. The bone is going to be better answer than the skin, sir. Better answer than the skin, sir. The type of burns which are happening because of the electrical current. Sir, if it is a low voltage, the scenario is going to be different. If it is high voltage, the scenario is going to be different. And if it is going to be the lightning which is coming from the sky, then the scenario is going to be different. If it is a low voltage, you are going to get the endogenous burn. एक जगह से entry, दूसरी जगह से exit, you are going to appreciate in this endogenous burn, or slight, some area is going to get a bit like this. Crocodile, which is high voltage, you will get a crocodile like skin. Crocodile like skin. जैसे crocodile की skin होती है ना, मोटी मोटी सी, that type of skin you are going to. Filigree burn, sir. I must request you to watch image. ड्यू टू द लाइटनिंग, सर. ड्यू टू द लाइटनिंग, सर. ऊपर से बिजली आई और पूरे शरीर में ऐसा serpentine type of pattern you are going to see. Pinkish color, serpentine type of pattern. This is what called as filigree burn, sir. This is what called as filigree. So low voltage, jewel burn. High voltage, crocodile burn. Filigree, sir, it is due to the lightning. Filigree, sir, it is due to the lightning. Now, sir, different type of torture method. Who has discovered them? These came from Japan. These torture method came from the Japan, sir. Japan. टेलीफोनो, हम फोन पे बात करते हैं, अगर कानों को बार बार पीटा जाएगा, this beating method is called as टेलीफोनो. Falanga, bastinado. How I remember this in my style. Falanga is sounding like a lafanga. लफंगा क्या कराता है? बेइज्जती. तो याद रखना, लफंगा बेइज्जती, फलंगा बेस्टिनाडो. इसके पैरों में मारो, पैरों को मारो, पैरों, बीटिंग द सोल्स. तो लफंगा बेइज्जती कराता है, इसके पैरों को मारो, बीटिंग द सोल. ड्राई सबमरीन. Sir, plastic bag on the face. You're taking a plastic bag, you're covering the face anywhere. This plastic bag on the face, this is called as dry submarine. Dry submarine. Wet submarine. You're putting your head under the water. You're putting your head under the water. This is called as wet submarine. किसी का मुंह लिया, बकेट में डाल दिया, गटर में डाल दिया, कहीं भी डाल दिया, सूखी पन्नी ली, सर पे लपेट दी, सांस रोक दी. मेन थिंग इज सांस रोक दी. ड्राई सबमरीन, वेट सबमरीन. Sir, parrots preach. Hanging someone on to rod or pole. ऐसे किसी को लटकाया, यहाँ पैर बांध दिए, यहाँ उसका मुंह बांध दिया, हाथ बांध दिए, ठीक है. सो किसी को अगर रॉड पे लटकाया है, लटकाने को इट इज कॉल्ड एज पैरेट्स प्रीच। सॉ हॉर्स, ट्रायंगुलर सरफेस लाइक दिस वाज देयर सर, एक टांग इधर एक टांग उधर, बीच में बिठा दिया, दिस इज गोइंग टू बी द सॉ हॉर्स। शुरू में तो शायद कुछ नहीं होगा, और सोचो किसी को 10-12 घंटे बिठा के रखेंगे तो क्या हो जाएगा, धमाका। देन ब्लैक स्लेव, नेक्स्ट टॉर्चर मेथड इज व्हाट सर, ब्लैक स्लेव, insertion of hot metal, metallic rod or hot metal into the anus of a victim, नहीं, accused, accused। plant on, प्लांट क्या करते हैं, खड़े रहते हैं, इसी तरीके से प्रोलॉन्ग स्टैंडिंग, प्लांटॉन इज नथिंग बट प्रोलॉन्ग स्टैंडिंग सर, प्रोलॉन्ग स्टैंडिंग सर। घोटना, रोलिंग अ हैवी वुडन लॉग ओवर द लेग, डंडा लिया, टांगों पे चला दिया, डा 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 डा, दिस इज कॉल्ड एज घोटना, दिस इज व्हाट कॉल्ड एज सर, घोटना, घोटना, घोटना। So these are the 9 different torture method we have studied. Along with me, please, everyone. Beating the ear is called as telephono. Beating the soul is called as palanga or bastinado. Plastic bag on the face is dry submarine. Head under the water is wet submarine. Hanging person on rod or pole is parrot's breech, and making person sit on a triangular surface is sawhorse. Then insertion of hot metal into the anus of an accused is black slave. Prolonged standing is planton, and rolling heavy wooden log over the leg is called as ghotana. So it's called as ghotana. This completes our chapter number 2, my dear friends. Now we are very good to start with the chapter number 3. And chapter number 3 is going to tell us about the death, and that is called as thanatology. Thanatology. The study of death is called as thanatology, friends. Sure. Let's talk about the study of death. Thanatology defined by the Declaration of Sydney. So who has defined the death? The death was defined by Declaration of Sydney. It was defined by Declaration of Sydney. Declaration of Sydney. First type of death, somatic death. Second is cellular death. See sir, somatic and cellular is different. पहले आपका हार्ट, लंग प्लस ब्रेन नॉट वर्किंग, हार्ट बंद नहीं करे, काम नहीं करेगा, ऑक्सीजन नहीं आएगी, धीरे धीरे लंग्स, ब्रेन खत्म होंगे, फिर कुछ टाइम लगेगा दोस्तों, कुछ टाइम लगेगा, जिसके बाद सेल्स मरना स्टार्ट होंगे, जिसको बोलते हैं सेलुलर डेथ। और जो दोस्तों सोमैटिक डेथ और सेलुलर डेथ के बीच में जो टाइम पीरियड लगा उसको बोला गया सुप्रा वाइटल पीरियड। क्वेश्चन ना, सुप्रा वाइटल पीरियड। So the gap, or you can precisely say time gap between somatic and the cellular death is, the time gap between somatic and the cellular death is called as supravital period. What is somatic death? Bishop's tripod. What is Bishop's tripod? Your heart, lung and brain stop working. Your heart, lung and brain stop working. Cellular death, your cells die. Supravital period, the gap between them. That's it, done. Thepnomy is a postmortem changes. In a normal death, postmortem में क्या क्या changes observe होंगे? Then my dear friends, the length of a person increases. Why? सवाल आता है क्यों? See, we living with this vertebra, S-shaped vertebra like this. We see horizontally. Lateral view will see it will be like this. After death, it will be like this. So you can see there is a slight increase in the length of vertebra that will lead to a feeling like increase in length of a dead body of a dead person, and this is what called as postmortem changes in a length. Second, two changes you are going to see in the eye. One is Kevorkian sign, another is Streckner. Kevorkian 9 is because of retinal vessel segmentation. The retinal vessels are segmented. Blood clot, blood clot, blood clot. It will look like a rail road phenomenon. Railroad phenomena. And another one is Trachinoir. Here the sclera is involved. Timing is 3 to 6 hours. There's a triangular part. Triangular part you can see. This is because of deposition of blood in the sclera. In the sclera. In the sclera, sir. Algor mortis. Algor mortis. Algor is like a LG. LG fridge. एलजी का फ्रिज क्या करता है? टेम्परेचर को कम करता है, डिक्रीज टेम्परेचर, ठंडा करता है साहब। तो गर्मियों में जो ठंडा होने का रेट है और जो सर्दियों में ठंडा होने का रेट है वो दोनों अलग अलग है दोस्तों। समर्स के अंदर इट इज गोइंग टू बी 0.5 डिग्री सेल्सियस पर आवर। विंटर में इट इज स्लाइट फास्टर एंड इट इज गोइंग टू बी 0.7 डिग्री सेल्सियस पर आवर। एल्गर मार्टिस। So three things we have seen, four things we have seen, my dear friends. One is increase in length 2 to 3 centimeter. In the eyes, we have seen the two changes. One is Kevorkian sign, another is Trachinoir. Third, fourth important thing is Algor mortis, which is mimicking the company LG. And LG is making a refrigerator, and refrigerator work is to decrease the temperature. So after death, the body cools down. In summer, the cooling down rate is slight else, and in winter, it is slight more. The difference is just 0.2 degrees Celsius per hour. So in summer, it is going to be 0.5, and in winters, it is going to be 0.7. 0.7. Coming on to the postmortem caloricity. This was normally happening in everyone, but in certain deaths, कुछ मौत के कारण दोस्तों ऐसे होते हैं जिनके अंदर शुरू में टेम्परेचर बढ़ता है. दिस इज कॉल्ड एज पोस्ट मॉर्टम कैलोरिसिटी. Initially temperature increase, then it will decrease. Initially it will increase and then it will decrease. So what are the different reasons for the death? Cause of death is going to be there, my dear friends, where initial temperature increase is there. If a person is dying because of a heat stroke, questions, previous year question, pontine hemorrhage, bacterial activity, that is septicemia. In all those scenarios, the initial increase in temperature is seen for first 2 hours. पहले 2 घंटे में शरीर गर्म पड़ता है, फिर ठंडा पड़ने लग जाता है, और ठंडा पड़ने को बोलते हैं एलगर्माटिस. Algormatis, called as algormatis. Next is livermatis. Post-mortem staining. It is a mechanism. After death, the blood is pooling, and where they are pooling, dependent part. What is this dependent part, sir? If you can appreciate this body, sir, this area is touching the ground. This area is touching the ground. This area which is in air is called as independent. Sorry, dependent. But I'll take my words back. This is dependent. Dependent area from the blood, they are going here. From this independent area, this is independent area. The blood is going on to the dependent area, and because of the lack of oxygenation, this becomes a deoxy blood. Deoxy blood, and deoxy blood looks bluish purple. So that is why liver mortis, in the normal death, you are going to get your bluish purple color. Bluish purple color. Bluish purple colors. Bluish purple colors. Next coming, embalming or thanatopraxia. This is an artificial method of preserving the bodies by using the antiseptic or preservative like phenol, methanol. In Delhi, this service is giving in LH, Lady Harding Medical College. Timing less than 6 hours. Timing less than 6 hours. You have to preserve it. You have to preserve it. So, coming on to the next chapter. Coming on to the next chapter, that is postmortem techniques. Sir, the autopsy is nothing but a postmortem examination, and first is medico-legal autopsy. Medico-legal autopsy is something which is practiced in India. Practiced in India, most commonly practiced in India. In this, the cause of death is unnatural death. For example, in a road traffic accident, a murder, a killing of someone. And here the consent of relative is not required. Being a law person, you have to give justice. For that justice, you do not need a consent for relatives because already there has been a mishappening and this was an unnatural mishappening. And best example you can take of a road traffic accident. Also suicide. Said this can be done on the requisition from an investigating officer who came for a police inquest filing a panchanama. He can give that. Clinical or pathological autopsy. This is again done for the unnatural death, but now the unnatural death is because of some disease, old age, diseases. Relative consent is mandatory. You need to investigate the proper causes, the other causes also. In that scenario, you need a relative consent. And if they want to do, well and good. If they do not want to do, we send them. Not mandatory to do. Virtual autopsy. So the whole body imaging is done. CT, MRI, X-ray, etc. So if without incision you are doing an autopsy, this is what called as virtual autopsy, my dear friends. Next come obscure autopsy. So the gross findings are minimal. You have given an incision, you're checking constantly through and throughout. You're not finding anything. Then you know to know for a histopath examination. Histopath examination. Microbiome examination. Chemical examinations. So those are the different. This is called as obscure autopsy. Negative autopsy. You've done everything, my dear friends. You have done everything. Your best you can do, you have done already. An autopsy fails to reveal the cause of death. Autopsy fails to reveal the cause of death. The first cavity, sir. The first cavity to open in what type of cause of death? If it is a poisoning case, is important to know. We open first a cranial cavity because once we open a cranial cavity, there is a smell coming out. And you will identify which type of poison was used to kill. Second is newborn. If someone is born, newborn is died, to do that autopsy, we first check abdominal cavity. Then coming the death is air embolism. We open the ventricles. If it is asphyxial death, again I want to highlight with yellow because something which is very important happening right here. In the asphyxial death, my dear friends, the first thing need to be open is a cranial cavity. After cranial cavity, thorax or abdomen. Then in the end, you are opening the neck. So first is cranium, then thorax or abdomen, then coming to neck because you need a bloodless dissection. Bloodless dissection. You need a bloodless dissection in the neck. And type of incisions which you will give, my dear friends, most common is I-shape incision. In infants, you give inverted Y. This is inverted Y-shape incision. Inverted Y-shape incision you give. So these are the different type of autopsies we have talked. What cavity need to be opened first we have talked. And the important incisions we have talked. The 2 pages we have summarized a chapter called as postmortem techniques, my dear friends. Postmortem techniques. Postmortem techniques. Then coming human identification. First of all, race. Race is being identified with the help of cephalic index. Sir. How to find a cephalic index? The formula you have to remember, just a quick recap: breadth of skull bone upon length of skull bone into 100. Now the 3 different races which we have to learn is dolichocephalic, mesencephalic and brachycephalic. Sir, dolichocephalic, mesencephalic and brachycephalic. D for dolicho, D for dark. Who are dark people? Negroes. So this dolichocephalic is something related to Negroes. Mesencephalic Indian people goes to China and do masti. Masti is sounding like Masset cephalic. So Masset is like Indian and Chinese. Brachy is something which is Mongol. Mongol. So you can start right from here 70 to 75, 75 to 80, 80 to 85. Yes, याद रखिएगा. Dolichocephalic, masset-cephalic and brachycephalic starting from 70 to 75, 75 to 80, 80 to 85. Dolichocephalic you are going to see in Negroes. Masset-cephalic you are going to see in India while China, that is Indian and Chinese. Brachycephalic you are going to see in the Mongols, my dear friends. Sex determination. In the bloods, in the females, you are going to see Davidson bodies, drumstick body, bar body. तो याद रखिएगा, Davidson is playing drum and female is dancing in the bars. This is how you will remember it. Drumstick bodies, Davidson body, bar bodies. These are found on the chromosomes of the female if you have to check the blood. Then comes best to male, differentiate male from female is a pelvic bone, my dear friends. So let's differentiate beautifully the male and female pelvis. Who's heavy? Larger and heavy, male. Smaller or lighter than a male. Oval shape, inlet if it is heart shape, आदमी का दिल. And female it is oval. If you see obturator foramen, inlet we have talked. And sir, if obturator we have to talk, obturator foramen is round in male. And in female it is triangular. Greater sciatic notch is the best parameter. Yes, I want to highlight for all of you. Greater sciatic notch is as a best parameter, sir. And best parameter, it is opposite. In male it is small and in female it is large and wide. In the weight, if you'll see large and heavy, whose it is of a male, it is lighter in the female. Obturator foramen, if it is round, we're talking about the male. If it is triangular, we are talking about the female. If the greater sciatic notch is small, we are talking about the male. If it is large, or you can say wide and large, it is of a female. So these are the basic differences between male and female pelvis, my dear friends. Other than that, we have talked about Davidson bodies, drumstick bodies, bar bodies. Those are also identifying matter for the female, sir. Coming on to the next part, sir. Age estimation. Age estimation, sir. Age of fetus rule of Hasse. So how it goes? This we are talking about first month, second month, third month, fourth month, fifth month. So it is going square, square, square. 1 centimeter, then 2 2s are 4, 3 3s are 9, 4 4 the 16, 5 5 the 25. On the fifth month, the baby's in the fifth month of intrauterine life, the height is going to be 25 centimeters. For the next 5 months, my dear friends, for the next 5 months, the height increases into multiplied by 5. So 6 5s are 30, 7 5 are 35, sir 8 5s are 40, sir 9 5s are 45, and sir 10 5s are 50. 10 5s are 50. So this rule is something called as rule of Hasse. The rule of Hasse is a very simple, beautiful rule to remember of. First 5 month initial, the height increases in the square, that is 2 2s are 3 3s are 4 4 the 5. Till 5 we stop, we reverse the formula into another form, that is multiplied by 5. So in the 6th month of intrauterine life, it is going to be into 5, into 7, into 8, into 9. Constantly. The baby, when it is getting out, the height of baby is, normal baby is 50 centimeters. 50 centimeters. Coming on to the age estimation by bones. Ossification center. What is ossification? Sir, your cartilage is converting into the bone. Your cartilage is converting into the bone. Cartilage is converting into the bone. Now clavicle, when it is converting into the bone, 5 to 6 weeks. So this clavicle is a special bone, most common Bone to get fracture. Most commonly 2/5, 3/5. If 2/5 is their fracture, sorry, if unilateral fracture is there, under arm sling. If bilateral fracture is there, we use a figure of 8 splint. Figure of 8 splint we are going to use, sir. Then sternum and talus, they're getting ossified at 7 months. Important, sir. I like to highlight it with yellow color. Leg. Sir, the lower end of femur and the upper end of tibia. Yes, I want to again repeat for all of you. The lower end of femur and the upper end of tibia, they get ossified during the time of delivery. During the time of delivery. Then bone fusion. Different part of bone, they fuse together to form a single bone. For example, our patella. Patella was a small bone. They're getting close together at the age of 14 years and they are making a single bone, sir. Xiphoid, sir, at the age of 40. We still have 12 years more to get our xiphoid into a single bone. So it is more on to the next part, that is 40 years. And now patella is 14 years. Skull bone is best for age estimation. And here we will talk about the sutures. The first suture to get fused is your metopic suture. कहते हैं ना मैं पहले metopic suture, and that is going to be the first year. Sir, the last suture getting is meseto-occipital. बहुत मस्ती हो गई, मरने का टाइम आ गया. 80 years. The best is Sajana Savarna Sajana Sagittal suture. 25 to 50 years. Again, I want to repeat. First suture, metopic, 1 year, well and good. Last suture, meseto-occipital, that is 80 years. Then coming the best suture, that is sagittal suture, 25 to 50 years. Now the identification methods, my dear friends. The number one identification method is poroscopy. Poroscopy is to study the skin pores, and this was given by Locard. To study the skin pores, different type of skin pores we have. This was given by Locard. Cilioscopy, to study the lip print. It was given by Suzuki. Palatography is the study of hard palate. And it was given by Allen. Study of hard palate. It was given by Allen. Anthropometry, Bertollian system. In this person's height, weight, body, dimensions, everything is noted. Body marks and measurements. This is Bartolian system introduced under the topic called as anthropometry. So the next is dactylography. Best to identify the fingerprints. And the system was Galton system by William Herschel. And this, the important thing you need to remember right here is Quetelet rule. Sir, what is this Quetelet rule? The fingerprint is not same in the identical twins. Even if it is a monozygotic twins, my dear friends, the fingerprints are not same. This is a very cute rule you have to remember. This is called as Quetelet rule. Quetelet rule. Classification of fingerprint was given by my friend Henry. And my friend has given very important classification which has been asked in the exam also, previous year topic. PYT. Sir, number one, most common is going to be the loop, whirlpool, and then arch. Arch is the least common. One more is their composite type. In this, arch is most common, otherwise composite. Now you can have a permanent loss of fingerness. Again, sir, previous year question. The multiple questions has been asked from this cute topic, sir. Identification method. So leprosy, radiation, and charring. Leprosy, radiation, and burning will lead to permanent loss of fingerprint. The question was asked like this. All of the following are the reasons for the permanent loss of the fingerprint except. So those three things you need to put in your brain. And along with me, I will help you. Leprosy, radiation, and charring. Leprosy, radiation, and charring. Now coming on to the next chapter called as what, sir? Asphyxial death. Asphyxial death. In asphyxial death, sir, The person cannot breathe properly. So, my dear friends, it is a beautiful day. It's going to rain, I guess so. Okay. Okay. Chili. Asphyxia. Asphyxia means cannot breathe properly. Asphyxial death. The triad you are going to see is very special right here, sir. The triad which you are going to see. Sir, cyanosis, petechiae, and congestion. Cyanosis, petechiae, and congestion. Sir, cyanosis means blue skin. If someone is dying because of the asphyxia, sir, there is going to be blue skin. Petechiae, that is pinpoint hemorrhage, and congestion, that is organ is going to be red. So outside skin is going to be blue. Eyes, you will have pinpoint hemorrhage. And inside, once you do autopsy, you will see the red congested organs. So this is what triad, asphyxial triad, you will appreciate. One song, sir. No song. I'm taking this class from my home. I can't sing. One is tardive spot. So tardive spot is a petechial hemorrhage in the eye. You can very well appreciate right here. Pinpoint hemorrhage. Trachinoid you have seen, Kevorkian phenomena you have seen. This is seen because of the neck compression, and most common site you will have a bleed is the conjunctiva. Sir. Then coming to the weight of constriction, कितना weight लगता है कौन से vital organ को compress करने के लिए साहब? तो here the mnemonic is JCTV. JCTV. Jugular vein, my dear friends, 2 kg only, carotid 5 kg only, trachea 15 kg, vertebra 30 kg. So, sir, the best you can take example as an incomplete hanging. The person is hanging. This is a rope. And the foot are touching onto the ground. Still person dies. How? The weight of the head is 10 to 15 kg. An unconscious patient is going to compress this carotid and jugular. So this becomes cause of death in case of incomplete. So this is having a significance. That is what I am showing you right here. So JCTV, jugular, carotid, trachea and vertebra. Type of suffocation, smothering, closure of oropharynx and nasal cavity. मुंह भी बंद कर दिया, नाक भी बंद कर दिया, मुंह दबा दिया तकिए से, हाथ से. This is called as smothering. So this is a beautiful way of a woman showing love to a husband so that she can take all the property, loving property which husband has made for a woman so that she can have fun. So this is what a cruel life is about, huh? Gagging. Obstruction of gag of a pharynx. Which pharynx we are talking about? Oropharynx. Oropharynx. Choking. Obstruction of airway by a foreign body or food. And in this, we perform a Helminch maneuver. Contraindication of Helminch maneuver is unconscious. In unconscious patient, we do a cricothyroidotomy. If cricothyroidotomy, we do a tracheostomy. So always remember, never do Helminch maneuver in a unconscious patient. That becomes a contraindication, sir. That becomes an contraindication. Contraindication. Traumatic asphyxia. Asphyxia due to the mechanical fixation of a chest. कोई भारी चीज छाती पे पड़ गई. Let's suppose some road traffic accident or some pillar has fallen onto the chest. Chest become mechanically compressed. You're not able to do inspiration, expiration, and the person dies. Or some heavy person is sitting onto the chest of a person, asphyxial death due to the mechanical fixation. Then comes burking. Burking is a mixture of two things. What two things? It is a mixture of smothering and traumatic asphyxia. Smothering and asphyxia. Smothering is covering of nose plus mouth, and traumatic asphyxia is mechanical fixation of chest. Mechanical fixation of chest. Mechanical fixation of chest. Other is positional asphyxia, sir. These are some surgical positions which were practiced previously, cause the severe damage to a patient, lead to the obliteration of these such position. One of those famous nowadays unused position is your jackknife's position. Sorry, jackknife's position. I'll again take you back to jackknife's position, sir. Then coming on to the next type of hanging. Sir, most common method used for suicide is hanging then poisoning, because hanging is quick. जल्दी मौत होती है हैंगिंग के, पॉइजन में आदमी खाएगा, थोड़ा फर्टिलिटी रेट पॉइजन के अंदर कम होता है, हैंगिंग के अंदर आपका मरने के चांसेस भी ज्यादा होते हैं, कम टाइम लगता है. Now, based on the position of the knot, we are dividing this hanging into two types. One is typical hanging and another is atypical hanging, sir. Typical and atypical hanging, sir. If a knot is placed onto the occiput region, यहाँ पे पीछे, this is called as typical hanging. And if knot is placed somewhere else, mandible के पास है, यहाँ कहाँ आगे की तरफ, this is called as atypical hanging, sir. This is position of the knot, sir. Simple way to remember. Position of the knot, sir. So typical and atypical. Based on the suspension, sir, complete partial hanging. Entire body weight acts as a constricting force. That means person who is up in the air, now the body parts are not touching the ground. This is ground, this is hanging person, this is tree. Person is not touching the ground. The entire body is acting as a constricting force. So that becomes the cause of death. Second is something which is interesting. And this is interesting for both of us, you and me. Partial hanging. Now, how the patient dies in case of a partial hanging. Here, the weight of the head. Previously also I was telling you guys, the weight of the head is 10 to 15 kg. 10 to 15 kgs. 10 to 15 kgs. And that will be enough to compress your carotid and the jugular vein, because carotid need somewhere 5 kgs and jugular needs somewhere 2 kgs. So carotid and jugular will be compressed and the person will die, because unconscious patient, your head control is not in your hands and you're going to somewhere accidentally compress your jugular and carotid, and that will ultimately lead to a cause of death. Postmortem finding in case of hanging. Tardive spot. What is tardive spot? It's a pinpoint hemorrhage. Pinpoint hemorrhage. Protrusion of tongue. Semen discharge. Dribbling of saliva. Hyoid bone fracture. This we have a hyoid bone right here, sir. Hyoid bone fractures. Simon's bleed. Simon's bleed, that is bleeding onto the anterior surface of the vertebra. So these are the finding you will see in case of a hanging. Special finding you will see in case of hanging. Plus object mark, or you can say pressure abrasion. जिस ऑब्जेक्ट से हैंगिंग करी होगी उसका मार्क भी छप गया होगा, ठीक है. और अगर उसमें मार्किंग इज यू शेप्ड, यानी खुद से है, सुसाइडल हैंगिंग. इफ इट इज ओ शेप, पीछे की तरफ, यानी कि पीछे से किसी ने घुट के मारा, दिस इज गोइंग टू बी द होमिसाइडल हैंगिंग. दिस इज गोइंग टू बी द होमिसाइडल हैंगिंग, सर. Then coming manner of hanging, suicidal. If you are
hanging by yourself, because people are choosing this method because this is a painless, takes only 3 to 5. Now fatal injuries are absent. Fatal injuries are absent. What are these fatal injuries? Fatal injuries are when the people are trying to save themselves while while hanging. If you are hanging yourself, you will not try to save yourself. There will be no abrasion, contusion, etc. Nothing will be there. But think, if some mob is there, he is going to hang you. You are going to save yourself. You are going to try your level best to save yourself. For that scenario, you will see that you will be having the abrasion, punctures, fractures, lacerations, etc. So these are covered under your homicidal hanging, where the fatal injuries are present, sign of struggle is present. Sir, the best example is mob lynching, homicidal hanging by a mob in a public. Third is accidental hanging, sir. While performing some kind of activities, you might using a rope, cuff, etc., and you end up compressing the neck accidentally. Intention was not there. This is called as accidental hanging. Then the fourth type of hanging, we have divided it into a judicial hanging, which is practiced in India. Every country has their different system of getting the death penalty, or giving the death penalty, not getting, giving the death penalty. So India is somewhere we are practicing a judicial hanging. Here the most common fracture we will appreciate is a hangman's fracture, sir. Hangman's fracture, sir. Now, type of strangulation. If you are making asphyxiate someone with the help of elbow, this is somewhere called as mugging. If you are using a metallic collar, and this is a legal practice which is done in Spain to kill someone. Like in India, we are using a judicial hanging. In Spain, we are using a garroting, and garroting is done with the help of metallic collar, where the person is made to sit on a chair, where the metallic collar is placed on the neck, and this is being compressed. The person will die. This is called as garroting. Throtting with the hand. Here you will see a 6-penny finger bruise. 6-penny finger bruise. उंगलियों के जो आगे की सतह होती है वो चिपक जाती है. बांस डोला with a stick. You have taken a stick, डंडे के मदद से गला घोट दी किसी. This is called as बांस डोला. And sir, in case of asphyxial death, already I told you, you need a bloodless dissection, sir. In that scenario, you will open first cranial cavity. Cranium cavity followed by thorax, abdomen. Then in the last, you will open the next. Then in the last, you will open the next. Then the last, you will open the next. Then coming, sir, wet drowning versus dry drowning. And before wet drowning and dry drowning, I want to tell you about the wet drowning is of two types. One is freshwater drowning, another is seawater drowning. In fresh water, lot of water is going inside. There is a hemodilution. Hemodilution will lead to increase in potassium. Hemodilution will lead to increase in potassium, and increase in potassium will lead to arrhythmias like ventricular fibrillation, and this becomes cause of death. In seawater, sodium is more outside, my dear friends. In the seawater, a lot of sodium is there. Namkeen, khara pani. So in that, what happens? Your water goes outside. Sodium concentration increases inside the body. So increase in sodium concentration will lead to bradycardia. So this becomes the cause of death. So my dear friends, in two of them, the scenarios are different. One scenario is telling you that fresh water, potassium is increasing, the cause of death is arrhythmias. Seawater, where potassium, sodium is increasing, the cause of death is bradycardia. The cause of death is bradycardia. Then coming near drowning. Now this is something: dry drowning, near drowning, and hydrocution. 4 types we have talked. One is wet drowning. Wet drowning is divided into 2. One is freshwater drowning and seawater drowning. Another comes to the dry drowning. Now you jumped into the water and there is a sudden laryngospasm. You jumped into the water there is a sudden laryngospasm, none of the air, none of the water going inside, the person is dead. Then comes to the near drowning. Person drowned. You saved. You saved, but after 24-hour person suddenly died. How? Lot of water went inside, there is electrolyte imbalance. First, lot of dirty water went inside, there is an infection, person dies. So these are the reasons for the near drowning. Now hydrocution, which is also called as immersion syndrome. Lot of reels you've been watching these days of a cold water jumping. So that need a lot of practice and it's a very risky thing to do. In ice freeze water, people are jumping. So if the ice freeze water is touching your epigastrium, there is a vagal nerve running along there. The vagal nerve will get a shock and person will go into the complete arrest of the heart activity. The person will die because of the vasovagal shock. The person will die because of the vasovagal shock. Vasovagal shock, sir. The postmortem changes in the drowning. Postmortem changes in the drowning, sir. Postmortem changes in the drowning, sir. Sir, antemartum drowning. यानी कि death of a person is happening in the water. Person dies in water. Person was alive, but the person dies inside the water. This is called as antemartum drowning, death inside the water. Sir, if death is inside the water, the person was alive. Person will try to save himself or herself. So there is a sign of struggle present. What are the sign of struggle? There's a clenched hand with some grass and mud particles. कितना तड़प के कोई आदमी मरा होगा कि उसने बचने की इतनी कोशिश करी कि जब पानी के अंदर था. तो there's clenched hand. ठीक है? Oh, it's okay. ठीक है? So next is lung emphysema. Lot of water going inside the lung. The lung is becoming big. And big lung is called as emphysema. Now this is because of the water. That is why we're calling it as a aquasum. Emphysema aquasum. Lungs inside the water. There is a subpleural hemorrhage. Now if lung is becoming big, the subpleural vessels are there. They're going to get bleed and there is going to be petechial hemorrhage on the lung. Mouth and nose. Lot of water going inside. Irritating your mucosa, leading to a frothy discharge. Mucoid, leathery, frothy discharge. Trachea, mud particles can be seen deposited onto the trachea. GIT, diatoms, very important. Sir, if a person is alive, that means, sir, if person is alive, that means blood circulation is present. Now the water which is going inside, it is coming in the lungs also. So your diatoms are getting into the blood circulation. From blood circulation, they are getting settled onto the long bones. So if it is an antemartum drowning, yes, diatoms are seen in the long bone because blood circulation was present. But if some person died before going to the water, यानी कि कोई आदमी मरा था, मरे हुए आदमी को पानी में फेंका गया, there is no sign of struggle, not at all. Frothy, mucoid, leathery discharge also will be absent. Diatoms will be absent because blood circulation is needed. The blood circulation, Bishop typhoid, we have seen. The heart, lung, brain stop working first. So that was something stopped. And that was stopped. And then you will realize that this person was died before standing to the water. So there is no sign of struggle. So this is what differentiate between the antemartum and the postmortem drowning. पहले से मरा था पानी में डाला इज एंटीमार्टम ड्राउनिंग. सॉरी, पोस्टमार्टम ड्राउनिंग. पहले से जीवित था पानी में जाके मरा इज अ एंटीमार्टम ड्राउनिंग. What is common you will see in an antemartum and a postmortem drowning, sir? Washerwoman syndrome. हाथ और पैर. If we will go to swimming also, you will feel the same thing. Washerwoman syndrome. Palm and soles are going to get wrinkled and thick. Flotation of the body. See, There are the chemical reaction goes, biological reactions which goes after the death. So that will lead to flotation of the body. In summers, when there is a temperature which is hot, it is going to be faster as compared to the winters. So winters, the flotation, if someone is dead inside the water, for the flotation in winters, it will take slight more time as compared to the summer. In winter, it is 1 to 2 days. In summers, it is because of the uh, high temperature, it comes early, as in 24 hours only. 24 hours only. Se- Sexual offenses. Chapter number 7, sexual offenses. Now, this we have discussed already, sir. Without consent, etc. Now, less than 18, with or without statutory. If you disclose the identity, 2 years, and burden of proof is always and always on the male. Now, crime scene, important. So, seminal stain, if you talk about seminal stain, if you got it, the 10% is going to be sperm and 90% is going to be semen. The 10% you have to identify with the help of 3 tests available, and these are important tests. कहते हैं Barbie went to Florida to celebrate Christmas. Barbie went to Florida to celebrate the Christmas. Barbie went to Barbie Rios. Barbie is a Barbie Rios test. F for fluorescence test. C for Christmas free strain. These are for the sperm. What left for the semen? The test which left for the semen is lactate dehydrogenase. Lactate dehydrogenase. Blood stain testing के लिए we are having screening and the confirmatory test कि blood stain किसका है. So we have a peroxidase with something mixed with the peroxidase, and that will change the name of the test and give different type of colors. Sir, if benzidine is mixed with peroxidase, it will give you blue color. If phenolphthalein is mixed with peroxidase, P for phenolphthalein, P for peroxidase, it will another give you P color, that is Kester-Meyer test, pink color. Phenolphthalein plus peroxidase, it will give you pink color. That is Kester-Meyer test. That is called as Kester-Meyer test. Kester-Meyer test. So PPP. Now comes OBG. OBG. Now orthotoluidine is mixed with peroxidase will give you blue green color. So benzidine will give you blue color. Phenolphthalein will give you pink color. Orthotoluidine plus peroxidase will give you blue green color. So these are the different colors you will get on the mixture of peroxidase with the different materials right there. So confirmatory. So those were screening. Now as per the confirmatory part, my dear friends, spectroscopy is better or best than Takayama and Tickman. Takayama image IBQ comes, my dear friends. Tickman, your brown color rhomboid structures are there. In this Takayama, you have red color, thin needle-like crystals present. That image you will see before going to the exam. And for the species, if it belongs to human or someone else, for that we have a precipitation test. So lactate dehydrogenation, electrodehydrogenase test was for semen, and Barbie and etc. they were for the sperm. Then coming orthotoluidine, etc. blood test, Kester-Meyer test, blue-green color come. Those all were for the this blood test, confirmatory blood test, spectroscopy is better answer than Takayama and then Dickman. For species, we have a precipitation test, precipitation test. Adultery. A male having a sex with wife of another male is not punishable, but a strong ground for divorce. Strong ground for sodomy, love, or buggery. Pino it goes. It can be between a male and female and can be between male and male. Pederast. A person having an activity with a male child, passive. Active male is called as pederast. A passive male child is called as catamite. Lesbianism, two female. One is called as butch, another is called as femme. Buccal coitus. Stimulus to male is fellatio. Stimulus to female is called as cunnilingus. It's called as cunnilingus. Bestiality with the animals. Perversions. Now you are definitely having fun but not doing fun. Sadism. A person enjoy giving the pain. He loves to give pain. That is called a sadistic personality. Person enjoys suffering the pain. Masochism. Person enjoy touching the private parts of the female is called as frotteurism. Person enjoy with the object related to the female is called as fetish. Person enjoy wearing opposite sex clothes is called as transvestism or eonism. Exhibitionism, 96 BNS we were talking about. Person enjoy the private parts in the public. Mooning, flashing and streaking. So flashing is a person suddenly shows the person shows a gluteal region and person running naked is streaking. So different three: flashing, mooning and streaking. Voyeurism, that also we talked about. Scotophilia or peeping tom are the different names. Person enjoy watching private acts of a female. Necrophagia and philia. Necrophilia is a person having with the dead body. Person enjoy eating dead body. Person enjoy while having the smell of feces is corpophilia. Person enjoy watching or having the smell of urine is urophilia. Sir. This I don't need to tell, just underlining and marking it with a red highlighter will give you a big red picture of it. Bobbit, a male genitalia is amputated by a female is called as Bobbit syndrome. Having a mobile sex is called as scatology. So these are the different perversions which you will encounter in the exam. Medical jurisprudence. Medical ethics teach you about the doctor-patient relationship, doctor-doctor relationship, doctor-society relationship. Violation of medical ethics are punishable, sir, and they are punished by the state medical council. If simple small case is there, sir, only warning is given. If such severe cases are there, the name will be erased, temporary or permanent. If permanent, we can go to the higher authority, that is NMC. If you're not satisfied the NMC, even you can go to the health ministry, my dear. You can go to the health ministry, my dear friends. The type of consent we were talking about in the beginning only, sir, expressed consent, that is explaining something orally and then giving in written, sir. Implied consent, the consent given by the means of gesture. That means, what is gestural right here? A female visiting male gynecologist. This is gesture. You're having perrectal bleeding and your male examiner has to check it. Gesture. Blanket, which is banned in India. This is not something related to Kambal Koot. This is something getting a consent for all the procedure at once, which is illegal in India. Earlier it was there. Earlier it was there. Now it is stopped. Why it is stopped? Because people were misusing it. Lot of cases has been filed in the pan India where organ trafficking was started. You're doing operation for gallbladder and you're taking someone's kidney. That has happened in the past. So India government law has banned this. Coming on to the part, sir, who is the best consent? Sir, written and informed is the best consent. And consent is never needed in an emergency and it's unexpected emergency during. You are already doing an surgery. Who can? Minimum age is 12 years. For the major procedure surgeries, 18 years. For the clinical examination, minor procedures, 12 years of age is sufficient. And if you have to perform a surgery in such patient, you need a consent from the guardians and those need to be our blood relatives. Medical negligence. Number one type of medical negligence is your civil negligence. Sir, your simple mistakes result into damage. For example, wrong prescription you have. In this, a patient can ask for a money for a compensation. And in this scenario, he need to get the prescription. He has to prove with the help of a prescription paper. Next is criminal negligence. Gross mistake result into damage. Doing surgery on the wrong patient. किसी का टी प्लास्टी करना था उसका सेप्टो कर दिया, जिसका सेप्टो करना था उसका टी प्लास्टी कर दिया. Now in this patient, burden of proof lies on the patient, but it is very obvious that the fact, or you can see the fact or mishappening speaks for themselves. In this, the number one thing is res espa lequitur. A very famous term has been asked in the exam also, res espa lequitur. Things or facts they speaks for themselves, like retained foreign body. Gangrene was there in the left side and you have cut at the right side. So these are res espa lequitur. Imprisonment plus minus fine is there on the doctor. Then coming contributory. Then coming very good dhare samajh gaya. Then coming contributory negligence, where the doctor and patient is both responsible. Being a doctor, you have prescribed a prescription and you have asked patient to come for a follow-up. Patient didn't follow that and you didn't check that you have to call that patient again. So this is something contributory negligence, and the punishment depends on the contribution. Who is more contributing towards? Again, the burden of proof lies on the doctors. So before writing the prescription, you need to be very concise about writing what date you have to come, what dose you have to take, how much dose you have to take, what is should be the duration, before dose, meal required or not required. Those all things need to be clearly mentioned on your prescription paper. Then comes a very fancy terms I would love to teach you is vicarious liability. Superior is respondent. A very simple word, but it will sue you. The more senior you become in this medical fraternity will lead you to the most responsible person. Being an intern, your all responsibilities onto the junior resident. Being a junior resident, your responsibilities onto the senior resident. Senior resident ka assistant professor ka associate professor, then professor, HOD, dean, owner. So this is how the things work in case of a vicarious liability. Your superior is respondent, sir. Chapter 9. Impotency, abortion. If you are impotent towards a particular woman, this is called as squad. And if it is cold female, you call this as frigidity. And this becomes a strong ground for the divorce. Sterility, inability to produce children, which can be seen in both males and females. Virginity, never had an before. False virgin, had, but the hymen was intact because of hyperplastic. And in penetration, posterior lateral side is most commonly getting ruptured. Masturbation, it is anterior. Now, two fancy things I want to teach you. Superfecundation and fitation. Superfecundation. So two ova fertilized in a same ovulatory cycle by the two separate act of coitus. Same cycle के अंदर दो अलग-अलग लोगों ने intercourse करा same female के साथ. They lead to superfecundation. Rarest condition. Superfetation. Two ova in a different ovulatory cycle. Two ova in a same ovulatory cycle is fecundation. Two ova in a different is called as fetation. Legitimate child. Child born during the legal marriage. Legal marriage के दौरान अगर होगा, then all your belongings belong to him or her. Suppository child, fictitious child. Female shows a pseudo pregnancy to claim money or to blackmail. You had a chance to sleep with someone, and after that, continuously she is accusing you that she's pregnant and you are the boss and you have to pay. But reality was not that. She's just faking it. She's taking money. In that scenario, if you're good enough to prove it, you can file a case against her. Posthumous child, sir. A child born after the death of the father. This is what called as posthumous child. Posthumous child. Again, asked in the exam. MTP. Medical termination of pregnancy. What are the indication? Therapeutic, eugenic, humanitarian, and socioeconomic. Sir, therapeutic. Risk of physical, mental injury to the mother, eugenic, exposure to X-ray, territory drug, humanitarian ground strike. Socioeconomic is failure of contraception. So this is a special case where the MTP is allowed till 20 weeks. 20 हफ्तों तक, yes, it is allowed. And after that, you are not allowed. If you are allowed special this, teratogenicity this, and it is to mother this, and this will be reviewed by the medical board. Less than 12 weeks, one doctor. Now this scenario is changed. Less than 20 weeks, one doc. 20 weeks or more than 20 weeks, you need two docs. And emergency may, yes, can be done on these such grounds, and which will be reviewed by your medical board. Which will be reviewed by your medical board. Sir, diploma degree in OBG, who can do? 1 year experience in OBG department, at least done 25, or you can say assisted 25 cases of MTP, 25 cases of NTP. Now coming to the next chapter called as toxicology. The last chapter we are going to cover today is toxicology. A small subject which we are going to cover in 2.5 hours, going to give us 10 marks, worth reading before the exam, worth at least I would say 80% of the marks you will get out of 10. And if you're lucky enough, you're getting more questions, you are more luckier that you are going to cover at least, if sometime it come 14, 15 questions, you are definitely going to get 12, 13 marks in such subjects. Those are the blessing subjects. And one of them is your ENT, FMT, short subjects. Now coming to chapter number 10, toxicology. Toxicology is nothing but a study of poison and is a father Matthew Orifila. Ophiology is the study of snake. So cobra and common crate. Cobra ka fatal dose is 12 mg, common crate is only 6 mg, and they both are neurotoxic snakes. So cobra and common crate is a neurotoxic snake. Treatment में anti snake venom plus neostigmin. Viper, V for viper, V for vasculotoxic. Sir. Two type of vipers we have, Russell viper and saw scale viper. Sir. Russell viper and saw scale viper. Sir, sea snake is a myotoxic. Sir. So neurotoxic, vasculotoxic, and myotoxic. So neurotoxic, vasculotoxic, and myotoxic. These are the different type of snakes we have studied. Now let's see the most common cause of death in case of a snake bite. The most common cause of death in a snake bite is a डर. डर के मारे जल्दी मौत हो जाती है, ज्यादा मौत का कारण है. But what is need to be done? That is a right approach. And what is this right approach, my dear friends? Right. Reassure. भैया दीदी मरोगे. Mobilize. Immobilize. Never put all those clothes etc. and never start sucking activities after the snake bite, which people do in the movies. That's a complete bullshit. Never ever do that. That's a blunder. Go to hospital and then start the treatment. So right strategy, start from reassurance, immobilization, go to hospital and then start the treatment. Anti-snake venom will be given in the cobra and the common crate. Cobra and common crate, they both are the neurotoxic snakes. Russell viper and saw scale viper, they both are the vasculotoxic snakes. The neurotoxic and the vasculotoxic snakes are there. Anti-snake venom. Anti-snake venom, sir. Now, sir, how to differentiate between poisonous and non-poisonous, sir? Sir, if two fangs are there, two bite marks are there, that will indicate this is a poisonous snake. And sir, if small bite marks are there, non-poisonous. Two puncture mark, poisonous. Multiple teeth bite mark, poisonous snakes. Plant toxins, sir. How they act? RBC agglutination. Number of seed and their name. Kitna fatal dose hai? One is strychnine, which is also called as Nux vomica. Strychnine, which is also called as Nux vomica. Sir, fatal dose is just one seed. Jamal gota, Nepala, diarrhea करवाता है सर 4. Castor 10. Dhatura, road rail side poison 100. My dear friends, स्ट्रिचनिन और नक्स वॉमिका के बारे में पढ़ेंगे. इट मिमिक्स टेटनस. मोस्ट कॉमन पोजीशन हाइपो एट टेटनस इज 8th डे डिजीज. 8वें दिन पे हो जाएगा. हाइपर एक्सटेंशन रेस्पिरेटरी मसल पर एंटीडोट इज डाइजेपाम्स. दतूरा फेटल डोजेस 100. दतूरा fatal dose is 100. It makes person sleepy, and this is most common roadside or railway poison. It's found in railways and roadsides most commonly. Earlier people used to put inside the food, and after the train or the bus passenger used to fall asleep, they used to loot them. तो इसलिए पुराने जमाने में कहा जाता था कि बेटा बाहर जाना, रास्ते में कोई भी कुछ दे खाना नहीं है, क्योंकि खाने में कुछ मिला देते थे. मोस्ट कॉमनली धतूरा विच वॉज कॉमनली अवेलेबल. लोग सो जाते थे, सोने के बाद वहां पे लूट हो जाती थी. जब तक नींदें खुलती थी सब लूट चुका होता था, सब बर्बाद हो चुका होता. दिस इज व्हाट कॉल्ड एज धतूरा. 9D पॉइजन. दिस इज ऑल्सो कॉल्ड 9D पॉइजन एक्सेप्ट डायरिया. डायरिया. Different type of daturas, my dear friends. Datura alba, nigra, and stramonium. Sir, Datura alba is a white color. Nigra is a black color Datura, and Stramonium is a thorn apple. Stramonium is a thorn apple. Stramonium is a thorn apple. Antidote is physostigmine. Rye poison is ergot. Inflammation of palm and sole. Tactile hallucination. You will feel like insect on faculty, not faculty, insect on body. Sir, this tactile hallucination is also associated with something else also. Cocaine poisoning. Chili seeds. It will again lead to dermatitis. Hunan hand. Hunan is a province in China. Sir, cannabis sativa. Mechanism of action is what? CNS stimulant. Active form is 9-tetrahydrocannabinol. 9-tetrahydrocannabinol is the active form. Products are marijuana, from where you will obtain it any part of the plant. Sir, bhang, dried leaf or stem. जली रस्सी जैसी बदबू आती सर इसकी. गांजा, very famous, from dried flowers and of a female plant. कहीं से भी ले लिया marijuana. सूखे पत्तों से भांग बनाई, और जो महिला वर्ग के फ्लावर थे उनसे बना गांजा. इसमें आती है रन एमोक जैसी फीलिंग. दौड़ने का मन करेगा, मारने का, मर जाने का मन करेगा, बिल्कुल कोई काम करने का मन नहीं पड़ेगा. पी करके आदमी लौट जाता है, उसको दुनिया वही नजर आने लग जाती है. दिस इज कॉल्ड एज इमोटिवेशनल सिंड्रोम एसोसिएटेड विद रन एमोक. ओपियम ऑल्सो नोन एज अफीम. एंटीडोट क्या है इसका? ओपियम प्रोसेस. वेरी इंपॉर्टेंट प्रीवियस ईयर क्वेश्चन. एंटीडोट इज नालट्रेक्सोन एंड नालेक्सोन. ट्रैक्सॉन इज ट्रैकिया, ट्रैकिया के पास में इसोफेगस, ओरल रूट से दिया जाता है. नालेक्सॉन इज अ सिस्टमिक रूट्स. And type of hafim we have a synthetic, semi-synthetic. In this we have opiate and opioids. Morphine, codeine, cocaine, है ना? And opioid we have a heroin, also known as smack or brown sugar. Now cocaine is also called as, sir, white lady. The cocaine is obtained. This is not cocaine, this is codeine. Cocaine is also known as white lady, obtained from coca leaves. And symptom you are going to get is magnum symptom. Tactile hallucination. Smoking, snorting. या तो आप इसको पियोगे या इसको आप नाक के रास्ते लोगे. सेप्टल परफोरेशन का भी काम है. सर नाम तो है व्हाइट लेडी, काम सारे काले काले. दांत भी काले कर देती है. ब्लैक टीथ, ब्लैक टंग. फेटल डोज 102 ग्राम अगर ले लिया तो आदमी मर जाता है. महंगी भी बहुत आती है. और व्हाइट लेडी से आप कब मिलना चाहोगे सर? रात को. तो याद रखिएगा आमिल नाइट्रेट इज अ एंटीडोट. कमिंग ऑन टू द नेक्स्ट. मोस्ट कॉमन सब्सटेंस अब्यूज इन इंडिया. अल्कोहल, शराब. और यूज क्या होता है? तंबाकू. अब्यूज अल्कोहल, एक्सेस ड्रिंकिंग करते हैं लोग, तो दैट इज अब्यूज. और सबसे ज्यादा यूज क्या करता है? टोबैको. टोबैको अब्यूज नहीं होता. टोबैको यूज कॉमनली होता है, और अब्यूज में क्या होता है? अल्कोहल. कार्बन मोनोऑक्साइड पॉइजन. सर In carbon monoxide poisoning, you are going to give a hyperbaric oxygen. What this hyperbaric oxygen does, it will take this carbon monoxide along with that, and it will flush it out. So carbon monoxide will put oxygen along with it and will flush it out. This hyperbaric oxygen will catch carbon monoxide and flush it out. Ideal homicidal poison is who? Answer is thallium. Ideal suicide poison is who? Your answer is cyanide. होमिसाइडल, किसी को मारना है तो थेलियम यूज करना है. थेलियम की क्या खास बात है कि बॉडी में डिटेक्ट नहीं होता. नॉट डिटेक्टेड इन बॉडी, नॉट डिटेक्टेड इन बॉडी. आर्सेनिक, आर्सेनिक किसको मिमिक करता है सर? कॉलेरा यानी कि डायरिया. सब एंडोकार्डियल ह्यूमरेज ठीक है, कोई बात नहीं. येलो मार्क कर रहा हूं सर, एल्ड्रिच मी लाइन. गार्लिक स्मेल, और गार्लिक कैसा होता है? व्हाइटिश कलर का. व्हाइट में तो याद रखिएगा. और गार्लिक के बाल होते हैं तो एंटीडोट इज बाल. रेड वेलवेटी मुकोसा सर, ब्लैक फुट डिजीज, ये सारी चीजें फेमस आर्सेनिक के साथ. आर्सेनिक के साथ फेटल डोज इज 100 to 200, नेवर बीन आस्क्ड इन एग्जाम. सर नेक्स्ट इज साइनाइड. साइनाइड इज आइडियल पॉइजन फॉर सुसाइड. बिटर आलमंड स्मेल, एंटीडोट इज अगेन आमिल. इससे पहले किसका था? सी वाले का ही. This amyl nitrate was again an antidote for previously taught you a substance starting from initial alphabet, that is C, and that is your cocaine. Cocaine and cyanide both are amyl nitrate. Amyl nitrate. Organophosphate, acetylcholine esterase block कर देते हैं parasympathetic activity. In parasympathetic activity, what will happen? Your heart rate, cardiac output, your BP, they are going to fall. Your other activities like GIT movements, they are going to increase. These are the parasympathetic activities. The antidote is going to be the atropine, oxims. Then coming to the next. What do you do in case of a poisoning? Sir, first you start the treatment, then inform the police. Then on the name of treatment, the best you use is a gastric lavage. But gastric lavage you do with what? Is a very famous MCQ, eval tube, IBQ. This is image-based question you need to know. And what are the contraindication for the gastric lavage? Is corrosive, kerosene. And what you will do if you can't do a gastric lavage? In such cases, you will use activated charcoal, sir. You will use activated charcoal. Now, these metal chelating agents, BAL, penicillamide, EDTA. So, BAL is British anti-leucide, contraindicated in iron and cadmium. So BAL is also antidote for the blackfoot disease poisoning, which was mimicking your cholera, and that is your arsenic. Penicillamine. Penicillamine is sounding like a pen. Pen is appropriate with a copy. So copper poisoning antidote is penicillamine. EDTA, lead poisoning. What you will encounter in a lead poisoning, sir? Bartunial line. Wrist drop because of the radial nerve involvement, sir. Basophilic stippling. These all are the things you are going to encounter in case of a lead poisoning, sir. Now, eval tube, you have done the lavage. Lavage was contraindicated in kerosene poisoning, corrosive poisoning. In that, you can use activated charcoal. But one more treatment is hemodialysis. And that is again contraindicated in KBC heroin. Sir, your K stands for kerosene. Your B stands for benzodiazepine. Your T stands for copper sulfate and heroin. So hemodialysis, this is again a previous year question, my dear friends. The hemodialysis can be done everywhere except these four conditions. Repeat along with me. This can be asked in the exam. Kerosene, benzodiazepine, copper sulfate and heroin. Now coming to the next one is phosphorus is of two type, friends. One is white phosphorus, another is red phosphorus. White is also called as Diwali poison, which is toxic and smell is present. Which type of smell? Garlicky type of smell is present. But the red phosphorus is present in the side of matchbox, which is non-toxic, no smell. For both of them, my dear friends, the antidote is going to be the copper sulfate, CuSO4. if there is a toxicity of the copper sulfate, there is going to be the possy jaw, hand tremors, all of the area will be burned. All of the area will be burned. It is a corrosive poisoning. Mercury poisoning, sir. Minamata disease of Japan. Mercury lentis. There is a discoloration of the anterior capsule of the lens. Acrodynia, pink disease. The face and everything will become pink. Hatter shake. Glass bladder. Person becomes shy. This is called as erytherism. Again, the antidote is bal, my dear friend. Mercury poisoning, arsenic poisoning. The antidote is bal. Lead poisoning lead to plumbism, Bertullian line on gums, basophilic stippling on RBC, constipation, wrist drop because of the radial nerve, antidote, ETDA, my dear friends, ETDA, sir, ETDA. Ethanol poisoning, sir, ethanol poisoning. Driving limit is 30 milligram per cent. Now, if it is 80, it will lead to nystagmus. 150, motor incoordination is again 300. Now, latest one is in 100, you will have a slurring of speech. Up to 300, you will have a motor incoordination. And more than 300, the person might can die or can go inside the coma. Might can die or go inside the coma. Test is drunkometer and most commonly used is chromato. Methanol. Methanol is a dirty alcohol. Bad, desi sharab. Methanol is sounding like a menthol. Menthol ठंडा होता है तो snow field vision. Treatment of choice if someone is having methanol toxicity, hemodialysis, antidote is ethanol. Methanol antidote is ethanol, which is a original drink. Corrosive poisoning, acid versus alkali. Who is more dangerous? Sir, alkalis are much more dangerous than the acids. And this alkali will show ALL for liquefactive necrosis. And C for coagulative necrosis. The liquefactive necrosis is also called as colligative necrosis. Colligative necrosis. Coagulative and your liquefactive necrosis. Oxalic acid is an ink remover. Antidote is calcium gluconate. The case comes like this of oxalic acid poisoning. The person will be scraping the walls. यहाँ पे paint चूना होता है वहां पे करता है. Coffee bean vomitus is there. In this, calcium gluconate injections are given to such patient. Will get relieved. H2SO4, sulfuric acid, strongest acid. If it is going inside, the white teeth are going to be evident and black mucosa because of the burning. Antidote is magnesium oxide. Now, if you remember, I taught you, whenever there is a poisoning case, poisoning cases, you will first open the cranial cavity. Why you are opening the cranium first? Because of the smell you will identify. So these are the important toxins and the smell you will learn along with me. First is hydrogen sulfide. Sade hue ande jaisi rotten egg like smell will be there, sir. Ethanol, fruity smell will be there, sir. Nitrobenzene. So nitrobenzene may we have a shoe polish like smell, sir. Hemlock, which is a nerve poison. Carrot like smell will be there. Carrot like smell. Yes, carrot like smell will be there. Drug smuggling, two things you have to remember, sir. The last topic of today's class, body packer versus body stuffer. If you are packing a drug into a polythene and you're consuming it, and through the normal defecation it comes out from your body, this is called as body packer syndrome. And my dear friends, if you are stuffing that polythene into the cavity, you are putting somewhere, you're suturing under the skin, in the peritoneal cavity, etc., then this is something called as body stuffer syndrome. Body stuffer syndrome. So with this, we have completed our revision program, my dear friends. May God bless you all. May you all pass and keep studying, keep saying I'll pass. And if you have any query, feel free to reach on my social media profile, P Jamwal 7. will be happy to help you. May God bless you all. And a PDF link has been put in the chat box. You can simply click on there. Team Meduhub will be happy to help.